seperti dokter umum, dokter gigi, fisioterapi, namun kita hanya domainnya ke nursing seperti itu ya. Oke, Prema.
Okay, got that? Okay, so now I'm going to show you the video. Wait, it's been live stream. Okay. Just a minute. I need to share screen again because I'm going to show you the video directly, not from the screen, but from I already downloaded it here. Give me a minute. I'm going to share. Can you see the video of this young handsome man?
Yes, we can see.
Cannot see. Okay, cannot see. Wait a minute. Wait a minute. I need to see why I cannot see.
We can see, Ibu Prema.
Can see. Okay, I want to get rid of all these things at the side. Wait a minute. I'm a perfectionist. That's my problem. Wait a minute. I don't want all this. Just give me 1 minute. I want to. Okay. Can you see? Can you see? Yes. I see Devi. Can you see? Can hear?
Yeah.
Okay, because
Yes, I can see the video.
good. Because I see you're talking, so I thought you cannot hear. Okay, video is good. All right, I'll continue. Okay, start.
All right.
Excuse me, Prema. We can see
Wait.
your video.
What's happening?
The voice is not yet clear.
No voice.
There is no sound.
This I'm asking what's the issue. Okay, wait. Let me check what's happening first. I stop share. It should show, but I'm not sure why no sound. Okay, I tell you what, Junie, you have the video. Can you take over and show at your end? I will stop share. Junie, show the video from your side.
Okay, please help me, Ibu Junie.
Okay,
I thought
let me
that the
try.
video has no sound.
Okay, let me try another method then. Okay, wait. Let me try another method. Let me try again. Just give me a minute because across the seas things change. Just give me a minute. Just give me 1 more minute. If cannot, then Junie, you prepare your side. Wait, okay. Let me try this side again. Okay, I share the slide first because I also downloaded it. Let me see whether for the slide it works. Okay, this is my slide. Tell me if you can see the slides. Yes, no? You can see the
Not
slides.
yet.
Okay. Cannot.
Not yet.
Okay, I'm already sharing the slides, but it's not sharing. I'm not sure why.
This is the slide.
Yeah, you can see the slides. You can see the slides, right?
Yeah, we can see.
Okay, so now okay, all right, let's go through slowly. Yeah, I put it on screen mode first, full screen. Okay, see whether you can see. If cannot, Junie, you need to take over. If I cannot show from here. Can hear? Can you hear the video?
I can hear. I can hear the.
You can hear.
sound.
You can hear. Okay, all right. If you can hear, then I continue. I use this method then. Okay, I'm okay.
There is no sound, Prema.
No sound. Still no sound. Sorry.
Okay, still no sound.
Still no sound. That means something is wrong. Okay, never mind. Junie, can you show the video? You have the link. Julie,
Okay.
take over. I stop
Okay.
share.
Let me
Okay, take
give me
over.
time 1 minute.
Okay, take over. I'm going to stop share here. Wait.
Saya kirim ke Yoga ya, ke Dek Mas, di guest lecture ya.
Can one of you share the
Sudah
video?
saya sudah share. Buka grup.
I'll wait a minute. I'll wait. I only have one video,
Yes,
just
it's
6 minutes, so
okay.
that's okay. Don't worry. Okay, share at your side.
Halo, dalam
I
video
can
kali
hear.
ini kita akan mencoba membahas mengenai evidence-based practice.
Okay, it's already have sound.
Nanti semua bisa ke sana.
Okay, now
Okay,
I
please
continue.
continue, Mas.
Whoever is playing the video, continue the video. Continue with the video.
What, why, and how. Sebelumnya mari kita ulas sedikit sejarah dari evidence-based practice ini. Evidence-based practice merupakan konsep yang berkembang bermula dari evidence-based in medicine, yang kemudian sekarang lebih dikenal dengan evidence-based in healthcare. Khususnya untuk di bidang kedokteran gigi, juga ini bukan lagi menjadi sesuatu yang baru. Apabila kita lacak dari sejarahnya, ternyata ini dikembangkan di tahun 80-an di Universitas McMaster, Ontario, Kanada. Apa definisi dari evidence-based practice? Definisinya adalah merupakan integrasi dari the best available research evidence, atau kita bisa artikan sebagai rujukan atau referensi ilmiah yang terbaik dan tersedia, yang dikombinasikan dengan clinical expertise atau kepakaran klinis, ditujukan untuk patient values atau kebaikan pasien yang dikaitkan dengan angka-angka morbiditas, mortalitas, perbaikan gejala klinis, dan penurunan biaya, serta juga peningkatan kualitas hidup. Dari sini kita bisa ambil kesimpulan bahwasannya untuk bisa mengklaim kita telah menerapkan evidence-based practice, memang harus terdiri dari 3 komponen tersebut. Berikutnya, mengapa kita perlu melakukan evidence-based practice? Di saat jumlah database referensi atau rujukan ilmiah yang dalam jumlah luar biasa, dan juga dikaitkan dengan permasalahan antara subjektivitas dan objektivitas, baik untuk peneliti, pembaca, dan juga untuk praktisi, di sini kita bisa lihat bahwasannya evidence-based practice dijadikan menjadi pilihan utama atau protokol atau metode sistematis untuk kemudian mendapatkan pilihan terbaik dalam perawatan pasien. Oleh karena itu, evidence-based practice menjadi salah satu pilihan terbaik untuk kemudian memberikan pelayanan prima kepada pasien. Selain itu juga khususnya di bidang kedokteran gigi, di sini kita bisa lihat bahwasannya evidence-based practice merupakan salah satu kompetensi yang dituntut dikuasai oleh para mahasiswa kedokteran gigi. Kelak ketika mereka akan menjadi lulusan sebagai praktisi, diharapkan selalu menggunakan pendekatan evidence-based dentistry dalam pengelolaan kesehatan gigi mulut. Berikutnya, bagaimana cara melakukan atau mengimplementasikan dari evidence-based practice itu sendiri? Di sini langkah yang pertama adalah susun pertanyaan penelitian klinis. Kemudian langkah kedua, cari referensi atau rujukan ilmiah berdasarkan kata kunci dari pertanyaan klinis yang telah disusun sebelumnya. Bisa menggunakan akses terhadap database-database ilmiah. Di sini sangat tidak disarankan untuk menggunakan mesin pencarian seperti google.com. Sebaiknya yang digunakan adalah mesin-mesin pencarian seperti database PubMed, ScienceDirect, Cochrane, dan lainnya. Langkah ketiga, lakukan appraisal atau melakukan sintesis berdasarkan analisis kritis dari rujukan atau referensi ilmiah yang telah ditemukan. Yang keempat, aplikasikan sintesis yang telah diperoleh, yang dikombinasikan dengan kepakaran klinis, yang kemudian hal ini dapat kemudian didiskusikan atau dibicarakan dengan kebutuhan atau indikasi, kontraindikasi yang ada dalam kasus setiap pasien. Untuk yang kelima, tahap terakhir yaitu lakukan selalu evaluasi terhadap efektivitas dan efisiensi dari proses implementasi evidence-based practice ini sendiri. Di sini kita bisa lihat pada poin nomor 2, yaitu find the best evidence. Bagaimana caranya kita menemukan find the best evidence? Secara sederhana, apabila kita menggunakan database, ketika kita mendapatkan hasil pencarian sejumlah referensi atau rujukan ilmiah, kita dapat lakukan filter sesuai dengan kategori study design. Apabila kita lakukan filter, sebagai contoh, di sini kita lakukan filter hasil pencarian yang merupakan meta-analysis atau systematic review. Jika diperoleh hasil pencarian dengan kategori meta-analysis atau systematic review, kita sudah dapat mengambil kesimpulan secara sementara bahwasannya untuk pertanyaan penelitian yang kita miliki, ini sudah memiliki suatu referensi atau rujukan ilmiah yang diduga dapat dikategorikan sebagai yang terbaik karena berada di puncak piramida. Sedangkan untuk jenis-jenis study design yang lainnya yang berada di bawahnya, ini merupakan pilihan. Apabila kita tidak menemukan referensi atau rujukan ilmiah yang berada di puncak piramida, maka kita bisa mulai kemudian melihat referensi atau rujukan ilmiah yang berada di bawahnya. Di sini kita bisa melihat adanya narrative review, expert opinion, atau non-evidence-based guideline. Ini merupakan kategori rujukan atau referensi ilmiah yang paling rendah. Untuk bahan bacaan selanjutnya, saya sarankan untuk membaca buku-buku seperti A Beginner Guide to Evidence-Based Practice, kemudian How to Read a Paper, bagaimana cara membaca jurnal. Di sini juga ada khusus buku untuk di bidang kedokteran gigi dengan judul How to Use Evidence-Based Dental Practice to Improve Your Clinical Decision Making. Selain itu juga di sini ada jurnal Evidence-Based in Dentistry. Juga saya menyarankan untuk melihat website. Salah satunya adalah website yang dimiliki oleh ADA. Di sini alamatnya ebd.ada.org. Dan dalam website ini akan ditemukan beberapa list referensi-referensi bahan bacaan untuk mendalami mengenai evidence-based practice in dentistry. Itu mungkin pembahasan video kali ini. Semoga bermanfaat. Terima kasih.
Okay, can stop. Can stop. Okay, now I will share my slides. Thank you. Okay, can all of you hear me now? Yes?
Yes.
Okay, let's start. Now, the other video I will not show you, but I trying to teach you the principles. Okay, whether it's dentistry, medicine, nursing, summer. Okay, but I want to go into more time to go back to nursing, what you heard and how to put it into practice. Dia, can you ask them, is there anything they don't understand or do they have questions based on the video? Dia,
Oke, Prema.
ask them if
Jadi dari video yang sudah disampaikan, sudah dijelaskan bagaimana sih evidence base itu secara umum dan khususnya pada domain nursing. Jadi dari video yang sudah disampaikan oleh Prema, apakah ada yang ingin tanyakan atau ada yang masih bingung terkait dengan evidence based practice?
any question, I'm happy to take first.
Any question from student for the video?
If no, never mind. I continue. I will ask question later. Students, I told you my class, nobody can sleep because even in Singapore, when I teach, I walk up and down. Even the one behind watching video, I will stand next to the student to say, pay attention. So I believe you all are good students. I don't have to do that. Okay, this video I'm not going to show, but I want you to go and watch it yourself. Okay, so I want to ask you a question. So Dia, ask this question and
Yes.
call out any of the names that you have, any name, and ask the person to answer me. If English, better still. If cannot, Bahasa, but you translate. Now, all of
Okay.
you, do you are each one of you, because Dia can pick any name. If not, I can also pick the names. Do you, as a nurse, don't say, I'm a student. No, you are going to be a professional nurse. Okay? Do you, as a nurse, think we, including me, you and I, we need evidence in nursing care? think first. The first question, do we need evidence in nursing? If yes, why? If no, why? I need to know. Share with us your examples and the common theme in this video. What is it that this video tell you? Okay, Dia, Bahasa first, and then you pick any name and ask for me. Bahasa.
Oke. Oke, mungkin sebelum saya pick our student, mungkin dari studentnya ada apakah ada yang ingin menjawab?
I'm allowed to answer the question from the Mrs. Prema.
Yes,
Okay,
call me Prima. I'm
that's-
not married. I'm not Mrs. Just call me Prima. Okay, come.
Just
Go ahead.
call her
Prima.
friend.
Yeah, okay, go ahead.
firstly,
Prima.
thank you very much for the question. Let me introduce myself.
The rest
My name
mute.
is-
Everybody mute except the speaker. Yes, thank you. Go ahead.
My name is Mulyarta.
Okay, Mulyarta.
I'm as
go
a
ahead.
student from the international class. So here I just want to make a conclusion from the video and answer your question.
Good.
So
Tell
from
me
the
more.
video that I already watching earlier, I can
Good.
learn that evidence-based practice, especially in nursing or other profession in health worker, is really needed to make
Yes.
us creating dedication of intervention that's suitable for the patient. And also,
Yes.
as a student, we need to learn a lot about the evidence-based practice in nursing to create the good intervention to the patient and effective intervention to the patient. So for example, if you want to educate the people, especially to manage the blood sugar level in the diabetes mellitus patient, currently we use a leaflet or other media, but
Good.
for the effective and also the effective ways to share the information, I think will be good in the mobile application. So because
Yes.
I'm already create and research with the mobile application, namely DiaSmart, which is that mobile application can be accessed by all of the people, not just by the different with the leaflet, but we can actually access by our handphone in this digital era. So I think that's really effective than leaflet if we compare in the evidence base. And I already do some of the literature review using the ChatGPT or AI in this era, and I got the result that the mobile application is effective to educate the people with the diabetes mellitus to manage their blood sugar level, and that's really suitable to educate the people. Then we use the media like leaflet, poster, and many other media that we often use in our life. So from
Very
the video
good.
also we can learn about how to create and choose the evidence-based practice in nursing by searching the literature specifically in some of the specific media like PubMed, maybe NCBI, and other media that already have a legal license to looking for the research. And this is really needed for the nursing to create a paper or many texts of that given by the lecturer to us. So I think that's all about my answer. Maybe
Good.
there is some word error. I would like to
No,
apologize
no.
for the
There's
time.
no
I give
error.
back to
There's
the
no error. Give me
Mrs.
your name
Prema.
again.
Thank
Your
you so
name.
much.
Your name. Nama. Your
My
name.
name is Mulyarta.
Mulyata. Okay, Mulyata. Okay, Mulyata, I think the rest of you must give him a hand. Sebab it's good that you said a lot of good things. Very good. But I have questions. Okay, I want the rest of you to think, nursing students. I agree with you that mobile application is the in thing now. Right? Everybody is on the handphone, mobile is good. That one, there's enough evidence to say use mobile app. Good. My second question, which is more important, Mulyata, is when you came out with the mobile app, whatever you ask the patient to do, is it based on evidence? Help me, Dia.
Baik, Mulyarta, sebelumnya apakah sudah mengerti? Kalau
Yes.
The
misalkan
app is
pada
good. App is good, but
Yeah.
the evidence of the information in the app, is it evidence-based? Ask him again.
Oke,
Okay, I just answer. I'm not upset now, but I want them to think. Okay, ask him in Bahasa.
Oke, jadi mobile aplikasinya itu sudah sangat bagus ya, tapi kalau misalkan mobile aplikasinya itu akan diberikan kepada pasien, apa sih yang akan kamu suruh lakukan kepada pasien saat melakukan mobile application tersebut?
Okay, thank you so much for the
Good.
translator and also
Come,
Mrs.
tell me more.
Priyanka. Firstly, that I will do in my application to the patient, firstly is guide the patient about how to log in my application.
No,
And
that's not what I want. Sorry, that's not what I want.
I-
Those things that they do, where did you get the evidence that this will work? Where did you get the evidence? If don't have, never mind. I'll teach you what to do later.
okay,
Okay, then
Okay.
wait. Okay. All right, you hold your question. I come back to you later because I think very good mobile application, very good. You got step by step. My question is, whatever you tell the patient to do, I want to know where you got the evidence. Tak payah, don't answer first. Hold on to it. Let me teach. Then we'll go through it. Okay? Let's move on.
so how I tell the patient I have
Okay, wait.
evidence.
Don't answer first. Don't answer first. Let me
Okay.
go through first, then you
Oh.
answer me. Okay, so today, my dear students, I like Mulyata because he has already gone one step ahead. So I'm pulling him back to say, wait, keep that question. I want to bring all the other, I think there's hundreds of you inside there, to come back to see you understand what he says. So hold your answer, Mulyata. Okay, so today, let's use his example. Okay, he talked about patients with diabetes. So he is asking the question, is it good if I have a mobile app? Okay, mobile app, put the information to the patients with diabetes. Okay, but the evidence is correct. There's enough evidence to say mobile app is good. But my second question, which is more important, is there enough information given to the patient in the app has enough evidence? So today we are going to learn how to look for evidence. Whatever you do, whether it's a mobile app, whether you're with your patient, you're doing a patient education session, or a patient newly diagnosed, 25 years old, crying because now I got type 2 diabetes. I'm so young and it's so bad. My HbA1c is so bad. How do you sit down with the patient and tell the patient, don't say I understand, don't say don't worry. Let me share with you how to take care of yourself, how to take care based on international evidence. If I am your patient, I look at you, nurse, you are good. So far, okay? Translate for me, Bahasa, this important part. Dia?
Oke, jadi dari apa yang sudah disampaikan oleh Prema, jadi misalkan mobile aplikasi tersebut, apakah memang sudah termasuk dengan evidence base tersebut sehingga bisa membantu pasien, khususnya pasien dengan diabetes, mengerti bahwa mobile application ini sudah termasuk dengan evidence base dan sudah bisa berfungsi dengan baik pada pasien diabetes mellitus tersebut.
Got
Okay,
it?
that's all,
Good.
Prema.
So I'm very happy with Mulyata. He asked a good question. Is it better to use mobile app? So the first thing as a nurse you must do, what your classmate did was, he asked, is there a need to change? Correct. Change from the old leaflet, brochure into app. So he asked the first question. Very good. Very good. You question what you are doing. Okay. That question, there is a format how to develop. I will teach you. And that is called PICO. P-I-C-O. I need all of you to take a paper or pen or your handphone. You must know PICO. If you don't know PICO, you don't know evidence-based practice. Simple as that. Later on, I'll teach you what is PICO. Once you have the topic, like Mulyata, he is asking, can I use the app instead of leaflet to teach patients on diabetes? Very good. Good question. Next, what he said, I don't know whether you understood. He said he go to PubMed, he go to various database to look for evidence. That's step 2, which is what he did. Good job. He went to look for evidence. Okay, that's very good. And I also will teach you what to do in terms of evidence, but I won't have enough time to teach you how to look for evidence. That one is a separate another 2 hours. So today I'll teach you where to get the evidence. Number 2. Number 3, I will not do number 3. I went through my first set of slides with Junie. Yeah? It was a bit too difficult. Okay, the rest of you mute, please. Mute, whoever turn on the mic mute. Reason, you have not learned research process. All right, I told Junie next time for the next group of students, teach the research process first, then evidence-based practice. So in your case, you don't have it, it's okay. It's okay, I can teach you another day. Okay, now after you have the evidence from PubMed, for example, that your classmate say, Mutida said, you now have to ask yourself, wow, the evidence, the literature, the journal, very good. It tells me I need to do for diabetes patient. I need to make sure I check their blood sugar every day. I must make sure I give the treatment as ordered. If I have to give insulin, my food must be ready because after I give insulin, I have to give within half an hour the food. Why? Because I don't want the patient's blood sugar to drop, to go into hypoglycemia. Very good. All this got evidence, no issue, other evidence. So once you have the evidence, how to change what your classmate did is very good. He then put the evidence into a app. And now your patient has an app. You can go through the app with the patient. And you change the practice and you maintain the practice. Very good. So that is evidence-based practice, right? Any question what I just said? Ask them any question. Any question, class? So far what I said.
Ada pertanyaan untuk teman-teman di
What I
Zoom?
just said.
Silakan.
No? Okay, now look at the right-hand side. I want you to take a picture of this picture, step 1 to step 6. All of you take your camera, your phone, and take a picture. I give you 1 second. Take a picture because this is what you need to know about evidence-based practice. If you don't know this, there's no evidence, period. That's all. So take picture already? So what we are going to teach now today is first, I'm going to teach you how to assess the need. I'm going to do exercise with you. Then we go look for evidence. Then number 3, we skip because that's research process. But I will teach you a shortcut. Today I teach you shortcut. Then we're going to change like your classmate Mutelda did. He changed, use app. That is designed the change. Then he has already put the app out there, implement the change. He's doing it. Integrate it into every patient will have the app. That's evidence-based practice. Bahasa, please. Use this picture and explain, Dia. Start.
Oke. Jadi, mahasiswa dari beberapa learning outcomes terkait dengan PICO, kalian harus melakukan beberapa step, yaitu ada 6 step. Yang pertama, kalian harus mengakses the need for the change in practice. Jadi, kalian harus mengetahui apa saja sih practice yang kalian butuhkan untuk melakukan evidence base tersebut. Lalu, kalian menentukan di mana sih kalian harus mencari EBM tersebut. Lalu, melakukan critically analyze the evidence base. Jadi, kalian melakukan kritis apakah evidence base ini cocok untuk kalian analisis. Lalu, kalian pilih dengan design practice dan kalian bisa juga men-skip step 2 and step 3. Lalu bisa kalian langsung lakukan di step 5, implement and evaluate change in the practice.
Stop.
Okay.
Only
Yes.
skip step 3 because you have not
Yeah,
learned research.
okay.
Step 2 and 4 is in. Bahasa. Can you hear me? Bahasa. Okay, so step 2, look for
Oke,
evidence.
jadi
I go
kalian
through.
bisa melakukan step 3 aja.
Don't want to do step 3 because today I don't teach step 3. I only will teach step 2 and step 4 and then go on. So now you tell them, once we got the evidence, I'll teach them later how to get the evidence. I need them to do step 4. Tell them in Bahasa what is step 4.
Jadi
Design.
kalian bisa
Now, students, this is serious. If you're laughing, I'm a bit disappointed. Please mute yourself and please pay attention. If we know who's the student who's laughing, later on we ask question. Okay? All right, step 4. Step 4. Step 4, Dia.
Yes, yes. Jadi untuk step 4, kalian akan melakukan desain practice change yang akan kalian lakukan pada EBN tersebut ya.
Okay,
Oke,
then
down.
make the
Raymond.
change. Step 5, make the change.
Untuk
Step
step
five.
5, lakukan perubahan terkait dengan desain practice yang mungkin kalian rasa tidak perlu
Good.
atau tidak good
Make
kalian gunakan.
6, make it a common thing. That means every patient with diabetes will change and have the new evidence. That's step 6. Okay? Tell them,
Oke.
integrate and keep the
Yes,
change. Huh?
for this step. Yes.
6.
Jadi
Okay, good.
kalian mengintegrasikan dan melakukan maintain change in practice. Jadi kalian harus melakukan apakah ini sudah dilakukan oleh change practice pada pasiennya ya. Seperti
Bagus.
pasien diabetes mellitus, apa yang diperlukan seperti itu.
Next slide. Okay, this man from McMaster second was the founder of evidence-based practice. It was in the early 2000s. So 20 years later, we still use it. I went to Bintaro Hospital in Jakarta to teach evidence-based in 2003 or 2004. I was there in Bintaro as well. So what does it mean? It means 3 things. What is the 3 things? Let's look at it. You saw this picture in the video as well. Okay, so I'm going to go through quickly and you need to translate for me. Yeah? First of all, nurses, you are an expert in nursing. Do you agree or you don't agree? Call one of the names, Dia, call a name and ask the student, any name, just randomly take a name. Ask the student, is she an expert in nursing after graduation? Ask her. Ask
Mungkin
the
ada
question.
mahasiswa dulu. Jadi untuk clinical expertise ini, apakah ada yang bertanya, menjawab pertanyaan dari Prema? Atau tidak ada, saya
Are
tunjuk
you
aja
an
ya.
expert? Are you an expert or not an expert?
Okay, Anak
Yes.
Agung.
Any answer?
Please answer the question.
Okay, so I want to answer Prema's questions. From my opinion, yes, after we graduate, we can be actually called an expert because we already,
Well done. Good job.
yeah, because we already going through all the learning process in advance to
Good.
get in the graduation. So after that, we already have the knowledge, the practical experience, and therefore we can be called as an expertise. And we also
Very well
already
said.
did
Very well
our,
said.
yeah.
Good, good. So
Thank
all
you.
of you remember, very good. You will be an expert. Don't be frightened when you're a nurse. In the ward, what I saw in Bali International and some other hospitals in Bali, the nurse is so frightened of the doctor. The nurse don't want to speak up. I am not the expert. The doctor is the expert. No, the doctor is an expert in medicine. You are an expert in nursing. So you have number one. Number 2 is what I call here evidence. I'm going to teach you where to find. That one, easy to find. I'll teach you. Once you have these 2, you can change the practice. Believe me, I have done it in Singapore. We set up 2 centers in Singapore in the year 2000, 20 years ago. One in National University Hospital, Siti Zubaida, her name is somewhere inside because I also asked her to give me a slide to make it easy. Okay, that is a big hospital, National University Hospital. 20 years ago, we set up a center. Then when I was in the Institute of Mental Health, I had 2,000 patients with mental health. I also set up a second center, year 2000, in Institute of Mental Health, specifically to look for evidence for mental health. Okay, so that is not difficult. Let's move on. Now, the third one is patient preference. I'm going to explain and then, Dia, I need translation. Now, I can come out with evidence-based practice. I can tell the patient 1, 2, 3, 4, 5, 6, 9, 10 what ini semua. But Patient say, no, saya tak mau buat. What do you say? No, you listen to me. No. You must listen to the patient. Now I'm going to give you a true story. Okay, Dia, the story goes like this. In Australia, okay, let's talk about pressure ulcer. Later on, we're going to use the example, decubitus ulcer. In Australia, for decubitus ulcer, the evidence say they put kulit kambing, sheep's skin. That is the evidence in Australia to use kulit kambing. Faham? Now, boleh saya pakai kulit kambing di Indonesia, di Bali? Boleh ke tak boleh? Call any of the names for me, Dia. Take another name. I want an answer from the student. Can or cannot? Call a name
Oke,
for me.
Kadek Safira Parslina
Okay.
bisa menjawab.
I repeat the question. Boleh saya pakai kulit kambing? Ada evidence di Australia. Boleh saya pakai itu evidence di Bali? Boleh ke tak boleh?
Okay, please, Agung Putri, answer the question.
Okay, thank you, Prema, for the question. So I want to try to answer.
Try. Can or cannot?
Okay,
Boleh ke tak
based
boleh?
on our temperature, there are differences with the temperature in Indonesia and also with the temperature in the Australia. So that's why
Good.
the skin is
You cannot.
use
Cannot.
in
Bagus.
Indonesia.
Another clap. Well done. You cannot do what Australia is doing in Indonesia. So when you look for evidence, also ask question. Can I do this in Indonesia? Faham? So these are the three things. You are the expert, you look for the evidence, and then you listen to the patient. Take a picture of this as well. This is very good to keep in mind. Next. So basically what I'm saying is, yes, you can change. Your two classmates, Mutiara and just now the other classmates, say the same thing. You can transform care. You as a nurse can make better decisions. You don't wait for a doctor to tell you what to do. You can improve quality of care. You can improve quality of life for the patient. Now, let me give you one example. Again, I speak in English. Dia, if need to, you translate. Di Bali International Hospital, saya ada satu patient. Dia ada large cell carcinoma of the lung. Okay, cancer of the lung. So he is on tracheostomy, tracheostomy. The nurse in charge of the ward tell me, Prima, because the patient got a lot of secretions. So when I made my round, I asked the nurse in charge, why are you not doing the suction for the patient? The nurse in charge tell me, Prima, Dr. Diana cakap tak boleh suction. Jangan suction, tak boleh sebab ada cancer of the lung. I did not agree. Because the patient cannot even breathe with all the secretion, and you as a nurse tell me you cannot change practice. Come on. So I went to look for Dr. Diana. She's a specialist, a nice lady. I love all the Balani doctors, nurses, Allied Health. I love them. So I saw Diana along the corridor. I said, hey, Dr. Diana, come, let's talk. I asked her a question. Why is it, patient's name is Michael. Michael come from America. I said, why is it that you tell my nurses don't do the suction for Michael? I asked, saya tanya dia question, kenapa tak boleh suction Michael? Then Diana, dia specialist, dia cakap, Prof. Prima, I also don't know the answer. Oh my goodness. If the doctor don't know, you just listen and you do, that is wrong. So I told her, Diana, I tolong awak. I have lots of doctor friends in Singapore. Okay, I work in many hospitals in Singapore. I was, as in the CV just now, Diaz Asli said, I was a CEO, I was a chief nurse, I was a director of the system. A lot of friends in Singapore. Teman-teman banyak. So saya telefon dengan professor, head of department lung cancer. Dia teman baik. good friend with me. I say, Dave, dia punya nama Dave. I say, Dave, can you come on Zoom and teach my doctor that you can suction the patient with a large cell carcinoma? He come, he teach. After that, we change the practice. The nurse can suction. Agree? What I did, I improved the quality of life for that patient, Michael. I improved the quality of care just by asking one question. Why cannot suction? I ask. I change. This is what I did. So my question was, why is it I cannot suction Michael? All right. We looked for evidence. And of course, we get the expert from Singapore. Once we got the evidence, we change. We change and we made sure we can implement into practice. So the nurse was able to suction, but we gave some key points to say not more than 30 seconds, rest the patient, give oxygen, then suction again. Use this picture, Dia, and explain the issue of in Basel cannot suction patient, but we changed the practice in Bali International Hospital, Basel. I take water. You talk, Dia, you talk.
Oke, jadi tadi Prema said kalau dia itu bertanya kepada dokternya kenapa sih dia tidak boleh melakukan suction, padahal itu merupakan suatu clinical issue untuk melakukan improve pada pasien. Jadi, are the available relevant, apa sih yang menyebabkan dia kok nggak bisa dilakukan suction, apa best practice yang dilakukan pada pasien yang harus setepatnya dilakukan kalau dia tidak disuction, bagaimana keadaan pada pasien seperti itu. Jadi itu merupakan pasien preference yang harus terbaik pada pasien seperti itu.
Good. So we change. Then we change the
Yeah.
practice. That's all we did. That is evidence-based practice. Okay, I'm going to go a bit faster. If not, I cannot finish. This one, I already finished already. Now, you all got work to do now. I'm going to tell you to start question your practice. Wherever you work, you ask yourself, each one must come up with one question. One nursing question that you want to change. Later on, I will ask. Dia will find any names and I'm going to ask you one question. So each of you must come up with one question to say, I want to change practice. So you ask, what is the problem in the ward that I want to solve? Why do I want to change? The next two, you wait first later. Okay? So example. Every time you turn patient every 2 hours for decubitus ulcer prevention, is it evidence? Got evidence or no evidence? You ask. Okay, wait. I see what's the next part first before I give you a break. Wait. Nanti kenapa tak jalan? Okay. Before I give you group work, I want you to wait. Something is going wrong here. Okay. Now you tell them, each of them must think of a nursing question they want to change. 1, 2 seconds. Think now. Tell them. Dia, ask them to think of a nursing question they want to change. I can't hear you, Dia. Are you there?
Yes. Dia
Okay,
is
Dia,
here.
ask.
Yes, Dia.
Okay, ask the question. Tell them, each nurse, now you're a nurse, you're not a student to me, you are a nurse. Tell me one thing that you want to change from whatever you know about nursing. Think now and write down. Give them half a minute. Think now and write down. I give you 30 seconds. Start now. All of you write. I'm going to ask question later. One thing that you want to change as a nurse.
Oke, teman-teman semuanya di mahasiswa boleh silakan dituliskan apa sih yang akan kalian ubah gitu dalam praktik keperawatan gitu yang ingin kalian ubah selama ini. Kalian mungkin sudah praktik kan juga ke rumah sakit ataupun ke puskesmas dan klinik. Coba pikirkan apa sih kira-kira yang mau kalian ubah gitu. Nanti Ibu Dea akan memilih salah satunya yang mungkin bisa menyampaikan langsung kepada Prema.
Okay, write the question down. I'm going to ask you to do the next step.
Karena habis ini mau ke step selanjutnya, silakan jangan terlalu banyak ini problemnya, cuma cukup satu saja teman-teman.
One only. Just one nursing topic you have in your mind. Write it down and hold on to it. Now I need you, Dia, to tell them, and Bu Juni, I need to do group work, breakout room. Put them into their groups, and I want them amongst themselves. Let's say there's 20 of them. Just choose one topic, not 20 topics, one topic, one group. Okay, that you want to change practice for nursing. Bahasa.
Oke,
Dia,
sekarang kita akan, kita akan buat breakout rooms ya teman-teman semuanya. Tadi sudah dibagi juga grupnya dari breakout room 1 sampai 6. Silakan masuk grup. Nanti kita ada juga fasilitator yang akan mendampingi. Cukup nanti kita akan temukan satu masalah saja, tidak banyak-banyak ya.
Okay, I only have 5 minutes. Only 5 minutes.
Yeah.
Let me stop share. Wait, I stop share
Oh
first.
yeah.
Wait, I stop share. Now I
Yeah.
need Juni, I need the breakout rooms, and they only have to come out with one question. I give them 5 minutes. In 5 minutes, they have to come back. Juni, are you with me?
Yes,
Me?
I'm here, Prema.
Okay, all right, breakout rooms, just 5 minutes. I want one nursing question, that's all.
Okay.
Do now.
Yeah, let me organize the student ya, Prema.
Again, go.
Oke, mahasiswa silakan Anda masuk ke nama-nama yang sudah saya share, kelompoknya, silakan masuk ke grup masing-masing. Untuk mahasiswa yang tidak pegang tingkat 2 dan tingkat 1, silakan kalian mau masuk grup mana gitu silakan. Mohon diisi supaya grupnya seimbang, antara grup 1 sampai grup 6 jumlahnya seimbang.
Okay, join the group now, please. Today, whole day, all the lesson, you must work in your group. So please go into your group now.
Ya, silakan sekarang juga Anda bergabung ke dalam breakout room karena kita hanya punya waktu 5 menit.
Make it fast, come, go into your groups, quick. All go into your group. I still got 200 of you haven't go into your groups. Everybody must go into a group.
Ya, mahasiswa harus ada di dalam grup. Semuanya, ayo cepat.
I still have another 199 of you. Please go into your groups. Some more. All have to go into your groups. From now on, I will teach in your groups. Some more. Move. Keep moving. Keep moving. Keep moving. Still got 160 of you. Keep moving. I still have 140 of you. Please go and join your groups. Don't waste time. Some more 130 of you still not in your groups. So everybody has to go into the breakout room. No, I still got 120 of you. Move. If not, I'll be calling your names. Keep moving. Come on, faster. Go into your groups faster a bit. Faster a bit. Come on. All of you have to go to your groups. I cannot start until you're in your groups. Some more 100 of you still no groups yet. Go into your groups. Come on, move. Keep moving. So many of you still haven't joined. Come on, move. Move, some more. Move. Some more, keep moving. The 80 of you still haven't moved. Move. Keep moving, keep moving. Keep moving, Dia, ask them to move. Still got 70 of them. No, still have to move. I will not start until everybody joins the group. Move, some more move, keep moving faster.
Masukkan.
Some more, 60 of you, I'm not sure why you cannot join. If you cannot join, tell Bu Juni. Come, join. Some more, move,
Yeah,
keep
I will
moving.
move.
Move, some more, 50 of you, come on, move. Keep moving. No, I still got 50, I can't start with 50, still not in the groups. Move into your groups.
Kita room berapa?
Now it's 54 of you still haven't joined a group. Move into your groups, these 54 people here. Junie, why these 54 never joined?
Wait, I still input my student to the room.
Okay.
I have the student in.
Okay, put them in the rooms. Once done, let me know.
Ijo breakout room na kah?
Still got 15. I still got 12 people haven't joined the group yet. Okay, Dia, are you there? Dia? Oh, Dia. Where's Dia?
I'm sorry, Mrs. I used two
Yeah.
device. I already joined in breakout
Okay,
room,
all right.
but my
Okay,
handphone still joined here. For Miss Dea
don't-
already joined in breakout room. That's why
Okay, Dia,
they
don't
can't
join.
hear
Dia,
your
come back.
voice.
Dia, come back. Ask Dia to come back. Ask Dia to come back. Dia has to be with me. The rest, the students move. Dia, come back. Junie, ask Dia to come
Okay,
back.
I will come.
Yeah. Okay, Dia, are you back?
Hello, Mrs.
I need Dia.
I will change Mrs. Dea to help you to translate.
Yes, I need Dia to come back. Dia, are you back? You're muted. Dia, you're muted. I cannot hear you.
I will
Dia.
change Mrs. Dea to help you to guide.
Yeah, but Dia is muted. Can you hear me? Dia is muted. Ask her to not unmute herself. Juni, Bu Juni,
This moment I try to.
Bu Juni, Bu Juni. Bu Juni. I need Dia to come back
Okay, okay.
and and
Just a moment.
unmute herself. She's muted. Dia's muted. I need someone to give instructions to the students what to do.
Yeah, I will change Miss Dea. Can I change Miss Dea to guide the student?
Yes, yes, I need her. I need her.
I'm sorry, can I, Mulyarta, change Miss Dea to as
Oh,
your
okay,
translator or
okay,
guidance?
all right, okay. So Mulyata, now tell the students, I give them just 5 minutes. Each group must have only one question. And then type the question in the chat group. I want to see the question. There's how many groups now? How many groups are there?
Okay.
How many groups? How many groups are there? 6 groups, right? Bujuni,
Yeah,
how many
6
groups?
group.
Prema,
Okay, 6 groups.
I'm
Yeah.
here, Prema.
Okay. Can we ask the students
Sorry,
to write the question in the chat group? I want to see the question of group 1, group 2, group 3, group 4, group 5, group 6. I want to see their question. Ask them to
Okay.
write now.
room.
Okay. Mulyata, you tell them.
Okay. Ya,
Okay, thank you.
mohon izin Ibu, mohon izin Mrs. Prema, kepada seluruh mahasiswa diharapkan untuk join ke breakout room masing-masing sesuai pembagian kelompoknya, dan diharapkan untuk membuat pertanyaan sesuai dengan materi yang telah di-share oleh Miss Prema, dan nantinya akan dipresentasikan pada main room, pertanyaan yang telah dibuat menggunakan metode PICO. Oleh karena itu, kepada mahasiswa yang belum join ke breakout
No
room,
need
diharapkan
PICO.
untuk segera.
Not PICO. Just think of a nursing topic. That's all. Not PICO yet. Just a nursing
Oh,
topic.
yeah.
Pressure sore,
I'm sorry.
COTI, IV phlebitis, oral toilet. Just one nursing topic. That's all I want.
I'm sorry,
Topik saja.
pertanyaan yang dibuat berdasarkan topik keperawatan yang ditemukan pada saat praktek.
Just topik.
Bukan
Topik saja.
menggunakan metode PICO. Topik keperawatan
PICO
misalkan
nanti. PICO
seperti
belum aja.
fasilitas.
PICO wait.
Okay.
PICO wait. Just come
Okay.
back.
Okay, thank
Okay,
you.
I don't see. Ask them to
Okay.
type in the chat group. Mulyata, are you back? Come back again?
Yes, I can.
Okay, Mulyata, do me a favor. Check for me your side. If I were to leave them in the breakout room, leave them, don't come back. Am I able to share the slides in the breakout room? Can you see the slide? Let's say, for example, now I share. You go into any of the breakout room. Can you see my slide? If you can see, then let them stay in their breakout room and then we continue. I share the slide first to see, whether you can see my slide. Wait. Okay, Mulata, you check whether you can see my slide. Yes or no? Can they see in the breakout room my slide? Check for me. If cannot see, that means they all have to come back every time. Can they see my slide? Oh,
Yeah.
can see in the breakout
Okay.
room. In the
Sorry,
breakout room. Yeah.
For interrupted, your slide only share in the main room. We can see the
In the
slide
breakout room. Cannot see in the
in the
breakout room.
breakout room.
Okay, then all right. That's how I want to check. Okay, never mind. Are they ready with their question? Ask them come back. Ask them come back. Finish already?
Yeah.
They haven't typed the question.
I
Just
think
the
it's
topic.
already finished.
Okay, I close the room. Okay, close the room.
Breakout roomnya.
Close the room and bring them back. Close the room. Junie, close the room.
Okay,
And
I
bring
will
them back.
close the break.
Okay, wait a moment.
Yeah. Okay, close the room and bring them back.
So
No,
after
bring them
this,
back
you
first.
want this.
Yeah, I want all to come back. All to
Okay.
come back first. Close the room. All will come back. Close the room. I want the question that they have in their mind. Mulyata, is everybody back? There's still some groups haven't come back yet.
Breakout room will close in 1 minute.
Yes, it's closing now. Yes, 45 seconds my
Yeah.
side. Close the breakout rooms.
Yeah, 55 seconds.
Junie, how many students do we have total?
300.
300. So I still got another 100 over. Okay, let me wait for them to come back. Wait for them to come back. Still some more in the breakout room. Ask them to come back.
Yeah. They already come back in 30 seconds. In 20 seconds. Yeah. The breakout room already closed.
Yeah, just like they're coming back. They're coming back. There's still 50 of them still coming back. Wait for them. We wait. Because the class is too big, so we have to be patient. Wait. Kita sabar, tenang.
Oh yeah. Sabar.
Sabar.
We will wait.
Wait for them to come back. I still got 52 haven't come back. While they're coming back, Mulyata, are you still there? Or ask she who's going to help me to translate?
Yeah.
Who's
Yeah.
going to do the translate? Mulyata, maybe you open your video. I want to see your face also. Mulyata.
Yes, Mrs.
Kami prima. I'm not Mrs. I'm not married. Saya belum kahwin. Oi. Saya belum kahwin. Just call me prima. Okay, Mulyata, are
jangan
you?
panggil Miss.
Jangan pakai prima saja. Okay, unmute. Dia
Hanya
sudah mute.
prima.
Halo, Asi cakap dia unmute. Dia tak belum unmute.
Unmute. Nah, tolong buka gininya, voice-nya dulu. Mulyarta, please unmute.
Mana dia?
Ini
I'm
dia
sorry, I
Mulyarta.
had trouble.
Okay, alright. Okay, nama Mulyata, you got trouble. I go to Asi. Asi, is everyone back? Mulyata, you're still muted.
Yes.
Mulyata, you're muted.
I think already back.
Okay, can. Just ask the leader, or Dia can also help me. Each group leader, 6 of them, write the topic for me now. In the chat group now, write the topic. I need to know the topic first.
Okay,
Ask the group
start
leader.
with
Ask the
group
leader.
1.
Group 1, what is your topic?
Yeah.
Write down.
Group 1, please raise your hand. Tolong angkat tangannya. Leader
No, write
dari
the
group
topic,
1, raise your hand. Okay, write the topic, please.
The topic. Group 2 also write the topic. Siapa leader? Group 2. Group 2 leader siapa?
Just write
Teman-teman ketua grup 2, tolong ditulis topiknya di chat Zoom.
All group 3, group 3, group 4, group 5, group 6, all of them must write the topic. I am not seeing the topic. I still cannot see the topic. Ask them to write now. Just the topic. Is it COTI? Is it phlebitis? Is it pressure ulcer? Apa topik saja, satu word saja. Oi. I need to move on. I don't have much time.
Ayo.
Call the group leader's name to write. Call the group leader.
Yeah,
Okay,
this
group
is,
3. Okay,
Emma,
group
this
3,
is
good.
from group 3.
1, 2, 4, 5, 6. Quick, faster. Oi, lekas sikit. Okay, group 6 I have already. Group 1, 2, 4, and 5. Quick. 1, 2, 4, and 5. I need your topic. If not, I cannot start. Group 1, who's the leader? Asi, check the list.
Group 1, where is the group 1?
Check the name list and call their
Ayo.
names. Okay, group 1 is there. Group 2? Group 2 belum? 2 and 4?
Group 2, that month?
Group 2 and Group 4. I want to know the topic. Group 2, Group 4? Group 4, siapa leader? Oi, hurry up. Bangun, selamat pagi. Bangun. Okay, good. Okay, good. Good job. Okay, listen now. All listen. Listen now. Listen now. From now on, to make things easier, because the group is so big. Let me teach you first everything, then we go to breakout. If not very difficult, go breakout, come back. Okay, Junie, all right? Junie, okay? Because if not, very difficult to manage. Okay, I share screen now.
Okay, Prema.
Okay, I share first. Wait. Why my share disappeared? Wait. Kenapa saya punya share hilang? Wait, let me see what happened. Is my screen been shared? Can you see my screen? Something gone wrong here. Wait.
Not yet.
Not yet,
Oh yeah,
Prema.
something is wrong here. Wait, hold on. Something's going wrong here. Wait, it's still going back to, wait, no, it's still going. No, wait, it's not listening to my instructions. Wait, just give me a minute. Just give me a minute. Something is not right. Now I don't know why the share screen is not coming out. Is it? You say you can't see, right?
Yeah.
Okay, alright, try again this time. Okay, now try again. Okay, now jalan, cepat jalan. Now can see?
Okay, already so.
Okay. So thank you, the group leader. You got to help me. So all of you got a topic. Very good. Now I want to teach you how to use PICO. Okay, listen first. Dengar dulu. PICO stands for patient. Intervention is what you do. Apa yang awak buat. Macam tadi suctioning. Suctioning is my intervention. Compare with others control later, comparison and outcome. Okay, we want to focus on the clinical question. Right now, let me get my placer out again. I want to focus on the question that you said, and I'm going to help you to do the next step and how to change. Okay, let's move on. Let's try again. Okay, I'll give you an example first, then you ask question. This is an example of a patient, okay, elderly patient in the hospital with decubitus ulcer. So the P stands for patient, elderly, hospitalized patient, risk of pressure injury. I stand for turning the patient, reposition every 2 hours. Okay, is 2 hours better or 1 hour better or 30 minutes better or 5 hours better? You don't know, I also don't know. I don't know what's the evidence. Is it 2 hours? Why not 1 hour? Why not 30 minutes? What is the standard that we have been doing? As a nurse, you know, every 2 hours. But now I'm challenging you. Why cannot turn every hour? Can I change the evidence, get the evidence to say I can turn the patient every hour, or I can turn the patient every 4 hours? I want to know the evidence. Why? I want to bring down the pressure injury. So my PICO question, in elderly hospitalized patients, does individualized repositioning, it means every hour I change, compared to the standard. You see, the control is always the standard. The standard is 2 hours. Reduce decubitus ulcer. Now, who is going to translate for me? Mutiara or Dia? Translate. Hello.
Halo.
Okay, translate.
Jadi untuk mahasiswa, jadi sudah dijelaskan oleh Prima bahwa kalian menentukan dulu sampel PICO statementnya. Misalkan pada P, di mana orang tua yang mengalami hospitalized pasien memiliki risk of pressure injury yang tinggi. Jadi untuk intervensinya, untuk individualisnya itu harus dilakukan repositioning atau perubahan posisi yang terschedule. Jadi untuk compressionnya itu misalkan ada yang lebih baik 2 jam setiap 2 jam atau 4 jam seperti itu. Lalu untuk outcome yang kita harapkan itu untuk mengurangi insiden terjadinya pressure injury atau luka tekan. Jadi untuk PICO questionnya itu seperti ini. Oke, dari apa yang sudah disampaikan, apakah sudah jelas? Okay, that's all,
Okay.
Grandma.
All right. Next part. Later on, they will do the PICO for their topic. Tell them bahasa. Later, they will come out with the PICO based on the topic that they said in the chat group. Tell them bahasa.
Oke. Jadi setelah kalian sudah melakukan example-nya itu, kalian masukkan PICO sesuai dengan pertanyaan-pertanyaan yang sudah grup leader sampaikan di chat room.
Okay, later,
Okay,
later.
Prima.
Bukan sekarang, nanti.
Oke, sebentar.
Okay, so now you look. So using PICO, I say elderly patient, because patient can be any age. Can be 50, can be 60, can be 70, can be 80. So you want to narrow down. Patients 65 years old and above. Okay. What kind of setting? Acute hospital, chronic sick unit, community hospital, patient at home. You now have to narrow where is the patient. Patient above 65 in an acute hospital. Now, I want to compare. When I teach in Bintaro Hospital 20 years ago, they tell me they use coconut oil rub on the skin to prevent decubitus. I understand from Bu Juni, they still do in Indonesia. Okay, I want to check. Minyak kepala bagus tak bagus untuk prevention of decubitus ulcer? Saya tak tahu. Faham? So that's the intervention, coconut oil. Barrier cream is international standard. Internationally cannot use coconut oil. Only use barrier cream. Faham? Outcome is to prevent decubitus ulcer. So my topic now become, I want to compare between coconut oil and barrier cream to prevent pressure ulcers in patients above 65 in an acute setting. Understand this or need to explain? Quite clear, right? Okay, no question. Okay, move on. Keep this later because you need this later to do your question. Now, when you do that, you need to ask questions. So I'll ask questions. When I say above 65, I want to exclude who? Or I want to say only this group. So now I become only. Above 65, but I only want bedridden patient. Can you see I'm getting narrower and narrower? From above 65, 65 lebih, I then come down to patients who are bedridden, tak jalan, selalu tidur. Can you see how I narrow to bedridden? Okay? Anybody else, 80 years old, walking around, 90 years old, can run, tak boleh. I only want above 65, I narrow down to bedridden. That is called inclusion, I include. Okay? I also exclude children. I don't want children with decubitus ulcer. Faham? So I make my patient population clear. Second, I want to say the intervention. I only want coconut oil. I don't want anything else. I don't want cold compress. I don't want hot compress. I don't want other things. I only want coconut oil. So I narrow down my intervention. Next, what is the control? I already told you barrier cream is the gold standard. Lastly, what is it I want to measure? I want to measure pressure ulcer at 1 point or over 1 month. If today at 12 noon, I say, okay, nurses, check for me all your bedridden patient above 65, how many of them got pressure ulcer? That's point. prevalence. Or I can tell you, this week, starting from Monday to Friday, I want to know how many patients had developed pressure ulcers. That's the difference. Faham? Question. If got question, I explain further. No question, quite clear, right? Dia, ask them question.
Oke, dari apa yang sudah disampaikan Prima, apakah sudah paham di mana kita melakukan inklusi dan eksklusi dari Vico statement yang akan kita buat ya, adik-adik?
Faham?
Baik, sejauh ini, yes. I think they are understand, Prima.
Understand. Okay. Next. I want all of them, no need to go into breakout group. I don't do breakout group anymore because too many people. I want them to come out with their own statement and write in the chat group. Okay, write in the chat group. In elderly patients above 65 years, in an acute hospital, I got inclusion, right? Only bedridden, right? I got inclusion criteria. How does coconut oil compare to barrier cream present pressure ulcers? That's the question. So later on, maybe later, they need to fill up this. Tell them this in Bahasa. Later, when we do the group out, maybe we do breakout later. We do this later. They need to fill up this for me. And they need to present, at the end, there's presentation. Bu Rahayu, Pak Sukajo, Bu Juni will assess you. So take a picture. Later, you need to do this for me. This is your group work. Later. I don't do now because it's so difficult to go into breakout. Okay, so you go into groups, do this for me. Now, let's assume there's a question on, what was the question on? I saw on breastfeeding. I don't know which group. One group is doing breastfeeding. Okay, I want to say, okay, mothers who have delivered their babies last 24 hours, is it good to give formula milk? Formula means thin milk versus breastfeeding. Which is better? Is the formula milk, formula milk, or breastfeeding? I want to compare these two. All right, to what outcome? To increase bonding and increase, or maybe increase the baby's immunity. Got it? I want to search now. I want to do a search. My question is formula milk better than breastfeeding for babies among mothers who have delivered the first 24 hours, okay, to prevent baby falling sick or to increase the immunity? That's all I want to ask the question. So I now have a question in my mind. All of you must have a question. Then you go and search for evidence. Now, I'm not going to teach you the details, but I just want you to go on later. I'll give you time. You can use any of this database. Pak Mulitra also said just now, he used PubMed, he used Medline. You can use anything. There's so many databases out there. But for today, if you have database, go and search database. If you don't have, tak payah. You can go into ChatGPT. Put your question into ChatGPT. All right, ChatGPT will give you answer, but you must check the source. Ask ChatGPT for the primary source. Where did you get this evidence from? I got it from PubMed, then they'll give you the evidence. I got it from Medline. I got it from Journal of Wound Care. Somebody is doing wound care. Faham? This one explain. I'm not going to teach this, but they have to do it later. Later they'll do. Tell them in Bahasa.
Oke,
Bahasa.
nanti kalian akan melakukan nanti kalian akan melakukan beberapa pertanyaan. Misalkan tadi sudah disebutkan about breastfeeding, apakah breastfeeding secara langsung lebih baik daripada formula milk seperti itu. Jadi kalian bisa mengkaji comparison tersebut bisa melalui data search yang sudah disampaikan di PPT atau bisa juga melalui ChatGPT. Tapi kalau misalnya dari ChatGPT kalian juga harus menyantumkan sumbernya apakah dari PubMed, ProQuest atau data search lainnya. Nanti yang akan kalian lakukan. Okay, done, Prima.
Okay, all right. So they get the evidence. I want evidence.
Suara.
Now, when they search for the evidence on breastfeeding in ChatGPT, I want them to add in this word, systematic review. Tell them. That means breastfeeding, okay? Put systematic review of breastfeeding. Faster. In the
Jadi kalau misalnya
ChatGPT,
kalau
Go on,
misalnya
go on.
kalian melakukan pertanyaan di ChatGPT, misalnya tentang breastfeeding, kalian harus mencari systematic review yang berhubungan dengan breastfeeding atau comparison dari formula milk seperti itu ya, adik-adik.
Okay.
Oke,
Now you
dan
tell them
memang
why. Now you tell them why. Sebab if, let's say I did a systematic review, you can go and search in the database later, in 1999. I think you're not even born yet. 1999, I did evidence-based practice in Singapore. And I came out with the evidence-based guidelines for decubitus ulcer, 1999. So I actually went to search all the evidence. I went to critique the evidence, step 3. Remember, I'm not teaching you today, but I did step 3. Then I came up with the systematic review. So what happens now is other people have also taken all the evidence and put into a document called systematic review. Explain to them what is systematic review. They tell them they have the people out there, let's say like myself or maybe Professor John or Brown, somebody out there in the world has done a systematic review of your topic. So I want them to go and look for the systematic review later when they do their search. Explain.
jadi mahasiswa akan mencari systematic review dari topik yang sudah dibuat oleh masing-masing researcher seperti itu ya adik-adik. Jadi kalian harus mencari beberapa systematic review yang sesuai dengan topik evidence base yang akan kalian lakukan.
Faham? So later on when they do ChatGPT, systematic review of breastfeeding, systematic review of wound care, systematic review of whatever topic they have. Got it? All right. Okay. Now, when you do a search, let's assuming you got database search, you have access to Cochrane Library, to PubMed, to Medline, to CNAL. Now, this is another good source, Joanna Briggs. When you have a database, you can put in your words in your PICO, P-I-C-O. You can use and, so I put breastfeeding and formula milk. Okay? Then I put systematic review last 5 to 10 years. So you tell them later when they go into ChatGPT, they must follow this. All right, they can put in their PICO words. Let's say they're using breastfeeding among mothers below 30 years or whatever it is, their PICO words. Use the word and. I want systematic review of breastfeeding among mothers below 40 years old and breastfeeding for the first 24 hours. And then add in the last 10 to 5 to 10 years. We don't want 40 years ago breastfeeding, different story, different context, different generation already. Faham? Explain this, how to do this. The topic and go ahead.
Oke, jadi saat kalian melakukan search strategi, yang pertama kalian lakukan itu adalah melakukan PICO framework, PICO keywordnya dari P apa, intervention apa, kontrol apa, dan outcome-nya apa. Jadi untuk melakukan PICO keyword tersebut, kalian bisa melakukan kombinasi boolean operator dari and, or, seperti itu ya. Lalu untuk nanti setelah systematic review muncul pada data search yang kalian cari, nanti kalian harus melakukan include last 5 until 10 years seperti itu ya, sesuai dengan jangan mencari data search yang terlalu lama. Oke. Rema?
Okay, can I take over? So I give you the example here. Okay, pressure injury, repositioning, and systematic review, and individualized training, and nursing and older adults. So I put all the search things inside. Okay. Now I teach what is a systematic review. Later on they'll do after the whole person. Basically, it's looking for primary research. Primary research studies that has been done. That's all. Okay. It means what are you doing? You're looking for evidence, not just one research paper. Maybe you'll find 10 or 15. But the research paper are good, bagus. Usually we go for randomized control trial and statistically significant. You haven't learned, it's okay. Just know this is a buzzword, excuse me, for evidence-based practice. Once you get good research, then you change practice. Okay? So again, it's a synthesis of body of knowledge. Body of knowledge on breastfeeding, body of knowledge on wound care. Just summarize the evidence. That is systematic review. Now, don't worry about this, tak payah buat. But just know, if I want to do a systematic review, I also got step by step to do. But today we are not doing. Later on, you free, you go and search. Now, it is a bit far behind sebab evidence-based practice started in the year 2000. That is why the data is all 2000. And it still can use today. Again, we're not going to do that today. Later, if Bojuni wants me to teach you how to do this, I'm happy to teach. Okay? Now, so we are not going to do a systematic review. Okay, but I want you to search. So when you go into ChatGPT or Google Scholar, you actually will get this kind of things like decubitous foam dressing for treating pressure injury, patients of any age, Cochrane systematic review. Can you see that? You get the result that it is a systematic review. Another example, effectiveness of preventive care strategies to reduce pressure sores in children 0 to 18. A systematic review. You must have this word, then it's good. Now, don't worry about meta-analysis. That is another big topic which I will not teach today. Just look for systematic review. Faham? Any question? Okay, next one. So this is another good example. So this is on pressure ulcer in 2012. 2012. And this is in a very good journal, International Journal of Nursing Studies. Okay, see, preventing pressure ulcers, systematic review. So instead of looking for primary research, I go straight into this one. Got it? Faham? So if I go into this one, look at the abstract first. Now I'm going to the abstract. Look at the abstract. The abstract already say clearly, you want to do this person now who did a systematic review on pressure ulcers. They look for randomized control trial. I told you just now. They assess the systematic review. Don't worry about all these numbers. I'm not teaching. Okay. And then they looked at Australian Kulit Kambing. And the evidence shows that higher specific foam mattress, sheepskin is better. So now the evidence cakap. Pakai specific high evidence specification, the foam mattress is good and sheepskin is good. Others no good. Okay, others cannot draw conclusion. Can you see that in the abstract already you get all the answers already? Another example, this is a medical example. Cochrane is the #1 body, very good. They wanted to see, like me, every morning I get running nose. Even now I'm having a bit of running nose. I have chronic rhinitis. Okay, my nose is inflamed. Then I want to take antibiotic. Should I take or should I not take? What is the evidence? I ask myself. What is the evidence? Makan antibiotik or jangan makan? Saya tak tahu. So I go and look for evidence. So this one already done 2005. They did Medline search and all that. And they tell me can or cannot. Let's see, can or cannot. Now, look at it. They look at the antibiotic. Okay, antibiotic. versus control. Placebo is the control. Outcome is I got rhinitis. Okay, should I take? So I'm the patient population. Intervention is if I give antibiotic versus don't give to bring down rhinitis. Okay, rhinitis is inflammation. What's the answer? Okay, let's say they did all the inclusion, exclusion criteria, or don't have answer. Okay, the answer is, we go back, I think the answer is here. Okay, I don't have the answer. The answer was to give. At the end of this evidence, what these people found was, if I have pus from my nose, I must take antibiotic. But this one is 2005, 20 years ago. Tak jalan. Today, tak jalan. Tak jalan. Why? My goddaughter, who stay with me, she also got a lot of pus. I go and see ENT specialist. Okay, they do a swab. They took a nasal swab. Do you know? No bacteria, viral. So they never give antibiotics. They say drink a lot of water. I give you nasal spray. So can you see the time is also important? At that time, 20 years ago, they say can give antibiotics. 20 years later, cannot give antibiotics. So that is why when you search systematic review, put 5 to 10 years. Bahasa.
Oke, jadi dari Piko yang akan kalian lakukan, kalian harus menentukan secara spesifik apakah memang populationnya, misalkan dari dari pasien yang mengalami akut purulent rhinitis, lalu interventionnya seperti apa? Apakah memang hanya antibiotik saja yang bisa dilakukan kepada pasien atau ada cara lain? Seperti misalkan kita melakukan nasal swab terlebih dahulu untuk mengetahui jenis apa sih bakteri yang ada di hidung kita sehingga kita bisa melakukan intervention yang bisa dilakukan untuk outcome-nya seperti itu. Oke, Prema.
Okay, all right, I'm back. I went to take a biscuit to bite. Okay, very clear. Evidence is good, but it must be current. Cannot be outdated 20 years ago. Later, they will do their group search. This group work too. Later we'll do. We don't do now. Now, step 3. You have to analyze the evidence. As I said, I'm not going to teach you that because that is another workshop, another lecture. We go straight to step 4. Let's assuming I come back for decubitus ulcer. I got evidence to say what to do. Okay, I got evidence. Now, let's say I got this evidence. The systematic review say use support service, special mattress, not normal mattress. Turn the patient, 2 hours can, 1 hour also can. Is according to your hospital protocol. If your hospital say 2 hours, you turn 2 hours. Hospital cakap 1 hour, you change 1 hour. So based on your protocol, you can have a bundle to prevent. Okay. Skincare cannot use coconut oil. Let me tell you first. I'm shocked that we're still using coconut oil in Indonesia. I told Bintaro Hospital, tak boleh, no evidence. Tak boleh pakai coconut oil. That's where Bu Juni, I need to work with Polytechers and Ministry of Health to change your practice. Because what they're doing is not evidence-based. Then there's evidence, later on we follow up. There's evidence to say you put prophylactic dressing. That means, if let's say this is my ankle, bony, right? I put a dressing so there's no pressure. Lastly, teach. Now, look at the second part. Later on, I need you to explain, Dia. All this came from the systematic review to say all these are evidence. But The systematic review also say nutrition and risk assessment, not enough evidence. But remember, I said you are the expert nurse. Agree? You know, if I don't give the patient high protein diet, muscle wasting, the skin will break down easily. Correct? Or I don't give enough water, the skin is dehydrated, the skin will break down. So I know as an expert, it is good. I also know as a nursing expert, I must use Braden scale to check the risk of this patient coming into my ward. So although I repeat, Dia, you need to emphasize, although sometimes you might not get the evidence, but you are the expert. I will still give good nutrition. I will still use Braden scale. Bahasa.
Baik, jadi setelah kalian melakukan search strategi, akan muncul beberapa jurnal di mana dari jurnal itu kalian breakdown. Nah, apa sih yang work best atau yang memiliki keunggulan lebih baik untuk pasien? Nah, misalnya di sini ada 6, lalu apa sih yang ternyata weak untuk pasien? Ternyata ada 2. Nah, tapi kalian sebagai expert juga kalian harus bisa menentukan apakah ini benar work best atau work weak seperti itu. Jadi kalian juga harus preferensinya kepada pasien seperti itu ya. Oke, Prema.
Okay, good. Just like the example of Bali International Hospital, patient Michael, the nurses tell me and the doctor tell me cannot suction. Correct? But I still want to suction because he cannot breathe with all the secretion. So sometimes as a nurse, we use our clinical expertise to change practice. That's what I did. Now, after that, you need to go and do step by step. How will you take that previous time? I got how many items? 6, 7, 8 things to do, right? I want to do 8 things to change practice. How to teach the staff, how to educate, how I do training, how to go to the bedside and help, how to audit, how to have indicators. That means I want to measure the incidents for 1 week, how many patients got pressure sore after I put this evidence in. I want to do step 5. That's straightforward. When you teach in the clinical, don't make it a long lecture like today. Short teaching. Short teaching. Don't make big one. And this one is good. My dear nurses, all of you are good. When you graduate, you go to the hospital, you become the champion. You change the practice. You become the super user. Dia bahasa, this part champion.
Sebentar. Oke, jadi untuk step 5 itu ada 4 hal yang perlu kalian lakukan ya. Yang pertama itu staffing. Jadi kalian harus melakukan ketajaman pasiennya ini harus membutuhkan implementasi seperti apa. Lalu yang kedua, educate nurse through. Jadi apakah ini baik untuk dilakukan edukasinya pada pasien. Lalu implemented and monitor audit, lalu teaching dan strategi. Jadi kalian harus bisa melakukan systematic review ini menjadi lebih ringkas, tidak terlalu banyak seperti itu ya.
Okay?
Okay, Prema.
Emphasize this one, the champion. They are the champion. Tell them. Tell them they are the champion to change practice. Tell in bahasa.
Oke, kalian itu merupakan champion yang bisa melakukan clinical expertise sesuai dengan systematic review yang kalian bisa sebutkan dengan best practice-nya ya.
Okay, you are the expert. Remember that. Now, step 6.
Oke, ingat bahwa
After
kalian
Yeah, okay, go on, talk. Cakap.
ingat
Yeah.
bahwa kalian itu merupakan clinical expertise nanti ya.
Our
Okay,
yang expert,
that's
you
all,
are the
Prema.
expert. Okay.
Yes.
Now, after I do all this, I want to know whether I change the practice is good or no good. Macam Michael. Sekarang kita do suctioning. I supervise. Follow. I ask Michael, how are you? Michael, I good friend. I always talk to him. Michael, how are you today? He tell me. He can't talk very well, but little bit. I can breathe better. That's what I want. That is my success. Patient quality of care is good. Patients say, I can breathe better. That's what I want. So there are various ways to see whether you are successful. You can measure, you can ask patient, the nurse also, you can ask the nurse, how do you feel? Do you feel confident? If everything is good, make sure you continue doing it. Okay? Now, take a picture of this, all of you. All of you take a picture first. Take already? Now, I teach nursing students year 3, year 4 in Singapore how to change practice. I also teach them, mute, Bu Juni. There's another topic that later or not now, maybe year 4, design thinking. I do that in Singapore. We teach our year 3, year 4, even year 4 nurses how to start thinking, how to use AI, how to do innovation to change practice. So in Singapore, nurses are doing AI already. We are using AI to change practice in Singapore. So I use this simple framework. Later, when you graduate, graduate, perawat di hospital, you do evidence-based practice, use this model. You go and tell your charge nurse or in charge, let's say Bu Dia or no, Bu Veda. Say, Bu Veda, I went to see evidence. I think we can do better like this rather than that. Because international standard is here. Kita di sini, how to go up there. Then Bu Veda cakap, sister in charge, how? Saya tak tahu, saya tak faham. Sekolah saya tak belajar. Then you cakap, saya ada belajar. I help you. You take this model. Angkat ini model. First step. You tell Bu Veda, the sister, this ward tak baik. So many patients got pressure sore. Decubitors tak baik. Quality of care can be better. Can I help you to change? Create the urgency. Tell them it's urgent to change. Then you form a coalition. It's a team. You become the team leader. Bu Veda is there. You bring in the infection control nurse. You bring in the dietitian. You bring in the physiotherapist. You decide who will be in your team. You lead the team. Don't say, I scared. No, you lead. Then you tell the group, we want to change. Today, my pressure sore in this hospital decubitors is 20%. My vision is I want to bring down to 5%. You set the vision. You cakap, awak yang expert. Cakap, I want to bring decubitus ulcer in this hospital to 5%, from 20% to 5%. Then I have to tell all the nurses, right? So you are the leader. You go forward, you meet all the ward nurses. You tell them, this hospital, let's say it's Sangla Hospital. In Sangla Hospital, we are a team. We want to bring down the pressure ulcer rate from 20% per month to 5%. So you tell them what's your vision. So semua perawat tahu, wow, Bu Dia is bagus. Dia mau tukar. Bagus. Then you take action. You have the guidelines. You now go ward by ward to teach them what to do. You educate them. You look for champion in the ward. Right? Every ward got a champion. The champion will help you to bring down. You cannot do alone. Champion. Then create quick wins. Let's say after 1 week, we want to do 1 month. After 1 week, you do your incidence of decubitus. Wah, turun. Sekarang from 20% turun 12% saja. What you do? celebrate, create quick win, get excited, cakap semua. Eh, you did a good job, bagus. Pressure ulcer rate sudah turun. Bukan saya. Awak yang buat. You made it happen. You brought it down to 12%. This is the meaning of quickly tell them you win. Then everybody gets so excited, right? Semua happy. Then the perawat in charge, Weda cakap, okay, today my nurses, I want to buy donut for all of you. Or I want to buy pizza. Bila saya kerja di Bali International Hospital, selalu kita beli. Ask Grab to send in donut or pizza. Make people happy. Then they work together with you. Okay? Once they work with you, you bill. So now it's 20 to 12, 12, lagi turun to 8. Celebrate again. 8 come down to 5. That's what you want. That's your vision, perawat. That is your vision. And then you work with the director of nursing of the hospital to say, I tried this in my ward, success very good. I want to build it for the whole hospital. Semua ward, all the ward follow you. Budia, explain step by step the 8 steps to change based on evidence. Over to you, Budia.
Oke, Prima. Jadi saat kita melakukan implementasi EBP, ada namanya Kotter yang memiliki 8 step change model. Yang pertama, create urgency. Jadi misalkan ada pasien dengan decubitus ulcer atau luka tekan pada decubitus yang memiliki derajat 20%. Jadi kalian sudah menentukan nih, from a power correlation. Jadi kalian ingin untuk menurunkan dari 20% itu menjadi 5%. Jadi kalian akan membuat create a vision for change. Apa sih best practice yang sudah kalian temukan dari systematic review yang bagus untuk menurunkan decubitus ulcer pada pasien. Jadi kalian saat sudah melakukan vision tersebut, kalian akan melakukan communicate the vision. Jadi kalian sebagai leader, kalian komunikasikan ke tim kalian bahwa ayo dong, ini ada pasien dengan decubitus ulcer 20 derajat. Kalian ingin agar decubitus ini turun menjadi 5%. Nah, setelah itu kalian sudah melakukan komunikasi kepada tim, lalu kalian akan melakukan empower action. Jadi apa sih EBP atau best practice yang sudah kalian temukan pada pasien untuk melakukan penurunan luka tekan tersebut. Nah, setelah itu kan mungkin akan berhasil misalkan dari 20% ke 12% deh. Berarti kan memang sudah ada penurunan. Jadi kalian bisa melakukan create quick wins. Sebuah celebration dari hasil oh memang ada nih intervensi ini bagus untuk menurunkan decubitus pada pasien. Oke, setelah itu build on chain. Nah, dari best practice yang sudah kalian lakukan, kalian bisa melakukan intervensi tersebut untuk kedepannya pada pasien yang memiliki sakit yang sama seperti itu. Oke, Prima.
Got it? Okay,
Yes.
next slide. Then, of course, you check the rate from 20 to 12, 12 to 5. You check the rate. Group work. Okay, so this is the last slide. Basically, my dear perawats, to summarize, you are a clinical expert. You now have to help me to find evidence on the topic you already choose, okay? And tell me how you will change the practice. So we are going to do this. So you have your topic. I want you to go and search using your PICO statement. Remember PICO? Okay, and then tell me how you will change. That's all you have to do now. Wait, let me end my slide first. Give me a minute. Okay, any questions before I put you back to your groups, work group? Any question?
Okay. Yeah, please. We will
Ask.
open a new session.
No,
for
but don't,
question and
wait. Don't open first.
Oh.
No, wait. Pupu, Junie, wait. Any question that they don't understand, Dia, ask them first. They must be
Okay.
clear.
Ada yang belum mengerti, silakan ditanya kepada Ibu Prema. Tanya sekarang sebelum nanti kita akan lakukan quick vote.
If not, I will ask question. If you don't ask, I'm going to ask. Quick, somebody ask a question.
Ya, kalau tidak ada yang bertanya, nanti Ibu Prema yang akan bertanya
I
kepada
call
kalian.
you. You don't answer, I call you. I like to call people. Come, anybody? What you don't understand, tell me. One of you tell me what you don't understand. Or what you understand. Maybe that's a better way. What you understand? Come, call one name for me, Dia. Call any name from your list. Any name from your list. Call one name for me.
Dewayu Tri,
What you
ada yang mau ditanya?
understand or what you don't understand also can.
Oke. Dewayu. Oke. Agung Putri, apa yang kamu tahu dan apa yang kamu tidak tahu dari apa yang sudah disampaikan oleh Ibu Prema?
All right, thank you for the change. So I think I have a question. I feel
Good,
confused with this part.
Ask.
Okay. Based on what are you tell before about the material is Pico.
Yes.
So we should arranging the sentence that we would ask in the ChatGPT or the other platform.
Okay.
And I
Go on.
still confused. Should we arranging the sentence based on P, E, C, O,
No.
or we can
Answer is no need. You can mix. We can mix. Sebab
yeah.
bahasa Indonesia different from English. So I
Yes,
cannot
yes, that's
introduce you
why.
like cannot. Tak jalan. Good question.
Okay.
You make it
Okay,
a
so
sentence that makes sense for Indonesia. Good question.
okay.
Next
Okay,
one.
thank you very much.
Any more question? If no question, okay, now listen. All of you listen. Semua dengar, and I need translation from Dia. Group 1, you want to look at AI, right, to make diagnosis. Group 2, you want to look at acupuncture for peripheral neuropathy. Group 3, you want to look at wound care. Group 4, music therapy. Group 5, nosocomial infection. And Group 6, breastfeeding. Good topics. Before you go into your work group, I want to give you time. Now it's 11:20. 11:20, until 12 o'clock. Until 12 o'clock, you go into your breakout room, okay? I need you to start doing group work 1, 1.1, group work 2, 3, 4, 5. Basically, all that I teach you today. PICO, find the evidence, plan the change, and make it happen. Faham? Okay, translate. Dia.
Oke, jadi kita diskusi nanti di breakout room sampai jam 12 ya. Sampai jam 12, sesuai dengan apa yang sudah kita pelajari tadi dari hasil pertanyaan, lalu kalian buat pikonya, lalu kalian sampaikan apa baik practice dari EBP yang sudah kalian lakukan. Nanti kita akan kembali di jam 12 dan mulai presentasi dari grup 1 sampai grup 6.
Okay,
sekian.
now,
Oke,
thank you.
Prema.
Wait. Bu Juni, I'm going to ask them to prepare PowerPoint and they present to you. Tell them in Bahasa, you are the teacher, not me. Tell them you want to see their PowerPoint. Only 4 PowerPoint slides. Each group, only 4, 3 to 4, cannot be more than 4. Because we only have half an hour for presentation. So each group, you tell them in Bahasa, you want to assess them. Maximum 4, can be 1, 2, 3, or 4 slides per group. They will present to you and me at 12 o'clock. You tell them in Bahasa. You are the guru. You are the professor. Come, you tell them. Juni, over to you.
Oke. Jadi mahasiswa silahkan nanti kita akan masuk ke breakout room sampai jam 12 membuat slide maksimal 4 slide. Setelah itu slide itu akan saya kirimkan ke Prema. Dikumpulkan ke saya. Nanti saya buatkan linknya, link drive.
And they must
Prema,
present. They will present to us at 12 o'clock. Now you open your breakout room. Let them go into the breakout room. Group leader take over. Okay, go ahead. Start.
Oke.
Start.
Silahkan semuanya masuk ke breakout room. Kita akan presentasi nanti jam 12.
Hello. From the Bible, Abitaku, from the Bible. Yes, Abitaku. Yes, yes. Yes. Okay, and I'm going to update you. I'm not these gentlemen. Okay, something more who we offer for instance. We asked people to hire not she's an intelligent kid that trying to be very well. But we were but she was the same person. The end of the I told them finally I gave it up. Okay, let's just speak. It's a very stressful. Okay, that's what I keep saying. I would never recommend anyone the children don't know. Okay, after that, the meet up all the okay, the age they get voice relationship. So one day she came back. Last 2 years ago, I sent part of the couple for the part. But one day I was going to have money I want to go to pay right? So like if mommy told me that so money, I say take it from me, you know there's this boyfriend or stuff. But I get it again, but it's happened. Now she's done for it. So they both are okay, and then it's her back because she's pushing for her face so much. Why do you take but the way from the fact that self God. They go to church, she falls asleep. When you sing to the choir and work together with the water, then you can actually the sound to take the book. So she knows we upset, but they don't have to go. I mean, I do my best. Here's what happened. They respond to the so they was launch and this double put it the other. Yeah, like was allowed there, but it's not big back. So I left it, I don't know, I was quite anyone, so I heard about that. Sure enough, they discipline master, they know that good. And she was part of the whole figured out the house. All she did, praise God. She said, I pray, Jesus, that go quickly next. Not concerned of prayer, and just not that. So then you should follow you for sure everything. So she came forward and said, Jesus help me today. I was like, okay, good news. She said it, I said, Jesus help me today. So I said, what happened? So then, so the mere fact that we're so close to solving the problem, the girl behind you got caught. All the teacher and the two they show me your way. But yet something prevented you. You ask yourself, was it you? Was it me? Oh, it's something else beyond you and me. Then I probably altered the you can keep your thing. What you could say. So I believe God is working. That would be, I don't know. Yeah, so all of us are really, the people background. Yeah, the history. The again, I got to involved with that was another thing for it to be for us, that you think is better. Like I'm not able to fix it. But you heard about it, that's how I made the big system of the and we have a year old social support. The first child for the but who love you? I want to be and the father the guy was okay. About the that came some energy. First, feel the mother was that. And she knows how to, and one day also knows. So she comes in to take him out. She ran with it. One other husband and wife and father. So I went. I personally don't say don't worry. Something. So one of the people that don't worry, but people think. So anyway, I went down. I offered after this one talking. So every weekend I'll bring her back to that. Then we speak. Of course, I always know that. And God that I'm 2 years old, everybody got one mother, I got 3. Because they see who is the well, you can have you get one. I wouldn't have got the age. I've got a little bit of out. So I know the so I think the way to question that I think so completely I really like God about them. No. So I have other also, but maybe I won't answer about that. I see God. I do some that if I need help, but I need to be around that powerful. And because the mother of the 2 of us were going to be just 70 apart, and we lived around after this. When you had started it and better for something, you know, and so we lived around the country, God, the school experience, and you experience it in order to know it. If you don't experience it, you do not know. That's my personal experience. Another day I can share with the fact that I would even be there. But doctor she had no book and cancer older, had very bad, literally textbook. The surgeon tried to rescue that we were going on Monday because the problem was next to the people. They would help. If we make one mistake, that's the kind of prognosis they tell you. All I knew was I could do anything. So someday they will not. Sunday morning, they get their army clothes. So we also the whole time, both of us think she would try. Because they are not a graduating father, and actually they should be receiving voting. 2:30 in the morning, I'm working. So she's the boss. And it's not no more picture, no more nothing. They look at me what happened. Then she got back to whatever. I knew what happened. Because he said it by the I then they were not sure, and so we were if we are going to stop, she don't have to go for this thing. Asian, life, and everything. Father, I again came to stop the beach. Amen. So, you must experience this. So, say that's all what I'm experience. That's why. And Father, I will go to I saw you last week at the big boy. But I want to because I do not see, but I see help there. Not I that God is with us. All right, Father, you are good day and if there's anything I can do for you or your priest, all right, thank you, Father, for helping us. Mommy, Father from Molina Church. No, I just ask you to come again. And Father, now group work. Hungry. Are we going to eat noodles? Okay, right, teacher, 12 o'clock, after 12 I can go. Then cook Maggi noodles for me. Cook Maggi noodles for me. Nothing much. Noodle much. 12:30 now, 12 o'clock starting. I bought this for her, she never eat. And I can. Oh, morning no sun now, then the sun. Okay, then. And wait, it's India, right? Oh, yeah, forgot about that, sorry. Yes, I know. Yes, wait. You want dry mee goreng or you want tom yum? Dry mee goreng, but I have to hit. Wait, one or two? One.
Ya bajuku belang. Aku belum cuci baju tuh. Udah benar? Yeah.
Mana dia tuh tadi?
Soon, presentation.
Tension. Iya, intervensinya model kayak
I'm back.
Halo, Tema, we are in
All back.
now.
I asked to breakout room close to
Oh,
breakout
sudah
room.
back.
All back. Okay. Come, let's start. Okay, Bu Juni. Who's
Yeah.
it? Okay, the lecturers are there, right? So they are going to listen to the presentation. They can present in Bahasa. I'm okay with it as long as you all understand whether they understand PICO. They know how to look for evidence. In this case, will be systematic review. Then how will they change practice? So let them present to you in Bahasa so that everybody can talk. And then I will try to listen, and then we can have a summary, and then we can finish at 12:30. Over to you, Juni. You want to get the group 1 to present first? Group 1?
Okay.
Where's
Okay,
group
we
1?
will continue with the group presentation, everyone. Each group is kindly requested to briefly present about PICO question and then the systematic review identified. Please, the first one is from group 1. Are you ready?
Okay, share slide. Ask them to share slide. Allow them to share.
Redita, help me please share the screen. Share the
Yeah, let them
slide,
share screen, and then
Redita.
we can all watch and see how they are doing with PICO.
Oh ya, oke, Muli can share the screen. Share the slide. All of my students in group 1, please listen Muli carefully.
Group 1, let's start because we don't have much time.
Terima kasih.
Okay, thank you for the time that given to me. So here, me as a leader of
I don't see his screen. Can we see the screen? Mulyata, I don't see your screen. Can't see. I only see here started sharing, but I don't see.
Kelihatan sudah share screen, tapi belum ada muncul.
Cannot see. Can you all see the screen because I cannot see?
Okay.
I cannot see the screen.
We still
Still
cannot see
trouble
the
in
screen.
my internet. Just a moment.
Okay, now it's beginning to show. Yes. They say page unresponsive.
Ya, terima.
Gen Z likes to use Canva. We all like PowerPoint. They all Canva, even in NUS summer.
But our device is not as good, not cepat enough.
I can't hear you. Let me see why I can't hear you.
Please start the presentation.
Yes, start.
Can we start?
Ya, silakan mulai presentasi dari sini aja deh, diri saya.
A bit bigger so we can see.
Ya, my student here. Please. Ya.
Okay.
Okay.
Thank you for the time that
Start.
you give me. My name is Mulyarta. I would like to try to explain the material about how effective the AI diagnostics
Now just use
and
your slide.
conventional
You go.
diagnostics.
Hello. Use the slide. The slide is too small. Open up the slide. Besar sikit. Tak boleh tengok.
Slide here.
Too small. You can see. I cannot see.
Slideshow-nya sudah. Muli, slideshow-nya mungkin maksudnya diperbesar.
Okay.
It's only 26%, so I have to see.
Tampilkan.
Make it full screen. The right hand side below. Right side below. Right hand side. Go down some more. Right hand side. Make it bigger. No. Make the screen bigger here. Right hand side here.
Cari slideshow-nya ada? Sudah?
Just a moment. The internet is not connect with our device. Maybe I try to use my friend
Okay, wait.
device.
Junie, tell all the rest of the students, make sure their internet work and the slide must be big when they get ready first for waiting for this one. Tell them in Bahasa.
Jadi kalau misalnya kelompok 1 masih belum bisa, kita lanjut ke kelompok 2 saja dulu ya. Boleh di stop share dulu ya teman-teman yang kelompok 1. Kita ke kelompok 2 untuk presentasinya.
Okay, number 2 come in.
Okay, group 5 ready to presentation.
Okay, bagus. Start.
Yeah.
Okay, again bigger. Yes, correct. Click on that. Click and make it bigger. Bagus. Good. Okay, start.
For my one doing presentation, so I am Mangsri. Will present about this topic. So our topic in group is COT, catheter-associated urinary tract infection. So
Good.
for the question, in ICU patient using urinary catheters, is the use of chloride-based antiseptics compared to povidone iodine effective in reducing the incidence of QLT during the treatment period? So for the eco question, we use in a population is a patient in ICU, daily using urinary catheters. And for the intervention, we doing chloride-based antiseptic, and for the comparison we use is povidone iodine antiseptic. For the basically we use when we wanna use urinary catheters.
Go.
And for the
okay,
outcome,
and
reducing in COT incidence during hospitalization. So for the clinical question, in ICU patient using urinary catheters, is the use chloride antiseptic more effective than pulpit iodine in reducing the incidence of COT during the hospitalization? So for the topic, comparison between the use chloride-based antiseptic and povidone iodine in preventing catheters-associated urinary tract infection among adult patients aged more than 18 years who are admitted to the ICU and used in delivering urinary catheters.
Very good. Next slide.
So this is best practice we use, such as including criteria and excluding criteria. For the inclusion criteria, we have
mute. The rest of you mute. Hello, only the staff talk. The rest of you please mute.
Jangan ada yang bocor, adik-adik.
Okay, I will continue. For the inclusion, we have 6
point. The first, adult patient age more than 18 years. Second is patient admitted to the ICU. 3 is a patient using individual urinary catheters. 4, when the patient using urinary more than 48 hours. 5, patient with the hemodynamical stable condition. 6, no urinary tract infection prior to catheter insertion. For the exclusion, we have 3, patient with urinary tract infection prior to catheter insertion. Second, patient with the allergic to chloroidine or povidone iodine. 3 is patient with severe hemodialysis. So this is a systematic review aimed to evaluate the effective of healthy prevention in better patient in adult patient aged more than 18 years. The method including comprehensive literature searching, Prisma-based study selection, quality appraisal, and narrative systems. The results indicate that intervention involving catheter technology, antiseptic, and healthcare practice significantly reduce quality incidence and are appreciated for implementation as evidence-based practice. This is for the clinical practice guideline. For the work-based evidence support strategies, we have 4. The first is use chloroidine-based antiseptic for peritoneal care. Its mean chloroidine significantly reduced the incidence of catheter-associated urinary tract infection compared with povidone iodine. 2, long residual effect of chlorhexidine. That's mean chlorhexidine provide at the present antimicrobacterial effect, whereas povidone iodine lacks residual activity. A third is antiseptic stability in the presence of organic matter. That means povidone iodine antiseptic active in reduced in the presence of organic matter, while chloroidine remains stable. 4 is significant reducing of healthy incidence in the chlorhexidine group. That means the incidence of KOT was lower in the chlorhexidine group compared to the povidone iodine group. So for the work with clinic practice, we get it 2 point. First, povidone iodine remains an acceptable alternative when chloroidine in contraindicate. And the second, no standard frequency for periotal cleansing was established. So here we got some literature. If you can see on the page. And for the I'm sorry, Prema, you're still mute. Can you?
Oh, sorry. So what is your conclusion?
So
the conclusion
here
is?
are the based on the various study, the use chlorhexidine for the peritoneal and urinary catheter care is more effective in reducing HOT incidence than povidone iodine.
Okay, stop here. Stop here. Stop here. Now, based on your evidence, are you convinced the group 1, the whole group 1, group 5, is it? Cortis, which group? Group 5. Okay. Are you confident that chlorhexidine got enough evidence and you want to change practice? Yes or no? Group 5. Just put up your hand to say yes.
Yes.
Only
Yes.
come on. The rest of the group, just put your hands up and say yes or no. Are you confident to change practice?
Yes, of course.
All of you are confident. Okay, good. I'm going to stop here because I got another group. Now, how to change? You use Cotter to go and change. And next time you graduate, Komang, group 5, when you graduate, you go and check this. If your hospital is using povidone, go and change the practice using Cotters because you don't have enough time to go through Cotter. I will stop here for group 5. Good job. Well done. Shall we give them a round of applause? Very good. Very good. Okay, I'm looking at time as well. Okay, next one. Who's ready? Are there all the hands coming up? Very good. Well done. Well done. Well
Thank
done.
you,
Learning
Prema.
has taken place. Very good. I'm so happy. Okay, wow, so many some more. Okay, next one. Class, so
Okay,
many.
for
Good.
group 1, are you ready?
Is group 1 ready?
Yes.
Or which?
Okay,
Ready? Okay, now do it. Let's
ready.
speed up because time is not in with us.
Okay, let's
Okay,
start the
start.
presentation.
Okay, thank you for the time that given to me. My name is Mulyata. So today I would like to present our topic about
Mute the rest.
effectiveness.
Mute the rest. Okay, only he. Okay, go on. Go on.
I'm sorry, I would like to
Yeah,
repeat.
continue, Murlita.
So our question is, in patients suspected of having diabetes mellitus, is artificial intelligence-based diagnostic assessment more effective than conventional assessment, improving diagnostic accuracy and speed of the patient? So
Good.
the population here is a patient with suspected diabetes mellitus, and the intervention to diagnostic is, the first is use AI or artificial intelligence, and the second is use conventional diagnostic. In comparison, we will compare the effectiveness and accuracy diagnostic of AI and also in the conventional diagnosis. And for the outcome, improving the diagnosis accuracy and early detection for diabetes mellitus using one of that diagnostic that we already compiled.
Okay. Outcome. There you go.
So,
Go back.
okay.
Wait, go back. First slide. Okay.
Slide number 1.
Now, class feedback, and teachers at the Polytechnic or Polytechnics also can give comments. You need to define diabetes. Is it type 1? Is it type 2? Is it gestational? Make it inclusion criteria. So who would you include in the diabetes now? What type of patients with diabetes? Is it type 1, type 2, or gestational diabetes?
Okay, for this topic, I choose diabetes type 2.
Then you must put it there. Then wait. Then you must say patients with suspected diabetes mellitus type 2. Make it clearer from the beginning. Okay? Good. Okay, next. Next slide.
Okay, we already do compare and we find the strength and weakness of the artificial intelligence diagnosis and conventional diagnosis, which is the AI diagnosis. We can get more strength.
No, sorry. I'm going to stop you here. Don't bring this in yet. Don't bring it. Go through the systematic part. After PICO, you got a PICO question. What is the next thing you do? What is the next thing? Don't talk about the AI diagnosis first. What's the next thing you do after PICO?
We will find the research that support
Yes, so go straight into it. This one is the traditional way of saying what is good. Go straight into research to show this is my PICO, this is my evidence. Now tell me the evidence. Tell me what's the evidence. Is it strong?
Okay, this is our research that we already find.
Okay, show me the evidence.
For the evidence, to be honest, I have not created the evidence, but I just create
Tell me. Just tell me what is the evidence. What did you find in the systematic review? Just tell me.
That I find if I do diagnostic from the AI or artificial intelligence with machine learning model and another model, we will speedily or quickly diagnose the patient than by conventional diagnostic. Because we just input the data of the patient in the application or website, we can directly know the prediction diagnosis of the patient. If we compare with the conventional, that will spend more long time to diagnostic the patient. So that's why I think the evidence base that I can find with the artificial intelligence is more preferred than
Good. My question. Okay, wait. Leave it there. I have questions. Now, can you do me a favor? Open up the abstract bigger. I want the class to see. Open the abstract bigger. Make it bigger. I want to see the abstract bigger. I want them to see why I'm telling you cannot change practice. Whereas you are saying you can change practice. Let me tell you why you cannot change practice. Open up the early detection, the evidence. Okay, go on. Open some more. Lagi besar. Some more read. Okay, I tell you what, take away the hold on. Take away the small picture, the heading. Okay, now class, look at this. Stop. I'll stop. Listen. Listen. Look at here. Wait. Last. Okay, stop. Enough. Cukup. Semua perawat tengok sini. The last 4 line. Can you see the word? Our results show no clinically relevant improvement. So this systematic review tells you if I use AI, there was no relevant improvement. Would you still change? Is there enough evidence, Murtiala? Would you still change? Is this evidence strong or no good? Good or no good? When the author himself say, our results show no clinically relevant improvement between, right, when more sophisticated. So now question, Murtiala, are you going to change your practice? Yes or no? The group, this is group 1. Can you hear me or not? Hello? Can you hear or cannot hear?
Yes,
Can
Mrs.
someone respond? Can hear me or cannot hear me?
Maybe some of my friends.
No. Murtiala, can you hear me? Boleh
Yes, I can
dengar?
hear.
Then answer. Okay, so Murtiala, I'm asking you a question. Maybe Dia, you need to translate the question if need be. This evidence that you show to me now, look at the last 4th line. Our results show no clinical relevant improvement. So there is no evidence that AI is better. Then why do you want to change practice? Bahasa, Dia, bahasa.
Oke, jadi dari evidence base yang kalian lakukan pada grup 1, apakah memang AI ini memang berpengaruh untuk kalian lakukan change-nya? Seperti itu.
Because the author tell you no results, no evidence. So do you change or don't change? Murtiala, answer the question. Do you want to change or you don't want to change?
Jadi apakah grup 1 mau tetap change atau di change? Karena no result seperti itu. Oke, silakan Mulyarta.
I think I will looking for another article because
yes, good. Look for more evidence, not article. Murtiala, don't look for article. Look for evidence.
Okay.
So you may have to go and look for other systematic review or good research. If you can't find systematic, look for good research. Never, class, take note, Dia, translate. Never change practice if you have no evidence. Tell the class. Dia.
Jangan sampai kalian merubah praktis tanpa ada bukti yang jelas pada IBN yang kalian temukan. Kalau misalnya no result, berarti tidak bisa dilakukan perubahan. Oke,
Faham?
Firman.
Faham, So we'll stop this for group 1. Group 1 got more work to do. Can we go to group 2 now? Group 2?
Yeah.
Okay,
Okay,
group 2.
group 2, you ready?
Okay, stop group 1 first because no evidence, so I'm not going to change. Next
Okay,
one.
please. Group 2, Demas will present it.
Hello. Bigger? Make it bigger, right hand side. Full screen. Okay, good. Start.
Hello, Firman.
Yeah, start.
Okay, good afternoon, Firman. I will tell you about our
Okay.
evidence-based practice we use. Here we use two evidence-based practice. That's for the first one, we use acupuncture for the treatment for diabetic peripheral neuropathy. And for the second one, that is acupressure for improving neuropathy severity in patients in diabetes type 2. So for the question we use, that is in patient with the diabetic neuropathy peripheral, thus we use acupuncture therapy to compare it with conventional drug therapy that's result in reduced pain severity. So for here we have the PICO analysis for the P or patient or the population. We get the patient with diabetic peripheral neuropathy or DPN experiencing neuropathic pain and numbness. For the intervention, that we get acupuncture therapy that's including about manual, warm, and also specimen matching points in acupuncture. For the compression, we got the conventional Western medicine that consume about mecobalamin, vitamin B, or some acupuncture. And O, or the outcome, because that is the significant reducing in pain, improved nerve conduction velocities, or NCVS, and higher clinical response rates.
Okay, go on. Go on. Next slide.
Okay. The next slide is best practice for the for
No,
both
no.
of the
I need, sorry, go back. I need the evidence first. I don't
okay.
want you to change if you don't have evidence. Simple as that. I need to see this literature that you're showing, the abstract. Show me the literature abstract. Is there evidence to change? Now, class, you take note. You cannot change if you have no evidence. Okay, move down. More, go down. I want to see the result of this systematic review. Go down, down, down. Turun, turun, turun. Go down, down. Just go down. Go some more, go down. Turun, turun, turun. Okay, stop. The results, stop. Oi, stop. Okay, the results suggested that acupuncture might be effective in improving symptoms of DPN in elderly. Owing to the low quality of the literature, we need more. Okay, stop. All of you listen. Sekarang saya ajar. Looking at the result of this systematic review, Adik, will you change your practice? Yes or no?
Yes.
Answer is no.
Yes, Bram.
No, you cannot change, darling. I tell you
Or
why.
no.
Answer is no. Why? I explain. Listen, semua dengar, dia translate. Read the conclusion. The results suggested, only suggested, no evidence. Only cakap saja. Suggested that acupuncture might be effective in improving symptoms of DPN in elderly. There's no evidence. They only think, they only suggest. And the word might means may happen, may not happen. That's the first. Second one, now this is very important. Owing to the overall low quality, I will underline the word low quality of the literature, we need more large sample, high quality, low bias. So that means to say, because it is low quality, no evidence, you cannot change practice. Dia, take over.
Oke.
Dia.
Baik, jadi dari kesimpulannya kan sudah ditentukan bahwa result suggests the acupuncture might be effective improving. Nah, dari itu juga kan ada low quality-nya juga. Apakah memang benar bisa kalian change mecobalamin itu menjadi akupuntur seperti itu?
So, Kadek, your group must remember, if you don't have strong evidence, you cannot change. Faham?
Ya,
Group 2 faham, huh? So if you cannot change with this literature, you can find some more evidence. Cari evidence. Bila ada strong evidence, then only you change practice. Dia, translate. You need strong evidence to change practice. Translate.
Jadi kalian kalau mau melakukan change, kalian harus melakukan evidence-based practice yang strong pada conclusion bahwa memang dia efektif untuk dilakukan pada pasien. Oke,
Faham? Faham, huh? Okay, so we'll stop here for group 2. So group 2 also cannot change practice. So far, only Koti can change practice. Group 5 can change. Group 1 and group 2 cannot. Let's look at 3 and 4. Now, don't get angry, don't get upset, don't cry, jangan menangis. We learn together. Okay, bersama-sama kita belajar. Okay, Murliata, jangan nangis. Okay, next one.
Okay, I really
Group
cry.
3.
Okay.
Don't cry.
Okay.
We're all doing our best, but you must learn the correct thing.
Okay.
Okay, next.
Okay.
Group
Okay,
3.
thank you, Prema. Group 3, please. From Bung Putri.
Share
While she
screen.
get ready.
For group 3.
Okay,
Yeah.
while she's doing
Group
that,
3 is
you all-
ready.
Okay, ready, start. Put the screen up. While waiting for it, now class. Hello, pelawat. Kalau tak ada evidence, jangan tukar. Kalau patient, like cakap macam kita pernah Hospital Bali International, Kalau kita tukar, ini American patient meninggal dunia, dia angkat saya pergi court. Pergi court, dia cakap, apa evidence? Tak ada evidence, mati terus. Oi, mati terus, so cannot change unless you have evidence. Okay? Mana group 3? Oi.
Ayo, grup B.
Lekas sikit, lekas sikit. Group 3 and group 4 and 6, get ready, please.
Wait, Prima, we still share screen.
Okay, can. You all understand what I'm saying? Faham ke tak faham?
Yes, we should
Faham,
compare
ah?
that.
Ya, faham. Bagus, bagus. Learning has taken place, Bu Juni. Okay, tell me your Pico. Full screen, full screen.
Full
Right hand
screen.
corner. Below, below,
Wait.
below. Turun lagi. Okay,
Okay.
start.
Okay,
Burns
group 3
injury.
from group 3 would like to present about our analysis. So the first
Okay.
is about PICO analysis and equation. For the population is adult patient with burn injuries grade 1 until 2. And then the intervention is skin allograft. And then this is skin autograft, and the outcome is time to wound healing. The burn wound. And then the
Okay, stop.
equation.
You say, but here salah. You must be clear. You just said it very good. You cakap time to wound healing. But
Yes.
here you put affect the result. Different, tak sama.
Yeah.
Dia help me.
I forget to change the
Okay, you understand,
Yes,
So you
yes.
must be specific. It's time to wound healing, not faster. Okay, good. Okay, go on. It's all right as long as you know the mistake. Okay, go on.
Okay.
Next.
So the question is, in adult patient with burn injuries grade 1 until 2, how does skin allograft compared to skin autograft affect the result in faster wound healing?
So it's no more faster. It's the time for wound
Yes.
healing.
Yes,
Change
yes.
that. Okay, next slide.
Slide.
Next slide.
Wait.
It's a good topic.
Okay.
Next
Wait.
slide. Oi, evidence.
There's still of trouble with the signal. Wait.
I need to see the evidence. Is the wound healing faster with allograft versus autograft?
Wait. Maybe there are some trouble with.
Okay, you tell me. What is your evidence? What did your evidence show?
Wait.
Autograft.
Okay, this one. This one is the summarized key
Okay,
findings.
bigger, full screen.
Okay.
Full screen. Okay.
Okay, autograft leads to faster healings and better graft survival in burn patient. And allograft helps protect the wound, reduce fluid loss, and control infection temporarily. And autograft should be performed as soon as the patient is stable. And about the SS availability of skin bank for allograft, operating room and trained burn surgeons, and consider patient condition, hemodynamic stability, nutritional status, and extent and depth of burn. And in
Okay.
research,
Good. Go on.
in research limited settings, allograft can be used as temporary management. Autograft prioritized when facilities and patient condition allow, and the nursing role is monitor graft viability, prevent infection, and educate patient and family about the stage of the treatment.
Okay, stop. Go backwards. Go back to the first slide. Something is wrong. First
Okay.
slide. Now, you are asking the question, how does skin allograft compares to autograft? That means to say the gold standard is auto, right? Gold
Yes.
standard auto. So most of the time we use auto. But now
Yeah.
you are asking, can I use allo?
Allo, yes.
Okay, so based on what you said, will you change to autograft or you will keep allograft? What will you change?
Okay,
What will
from
you
the
change?
I think we from the evidence base that
Yeah.
we already searched, we cannot just only use the allograft because we need to see our patient condition, and we should compare the allograft and autograft because autograft is the gold standard. So we cannot just use the allograft.
Good. Yes. So can you see that? Straight away, this systematic review tells you autograph is still number one priority.
Yes.
So you cannot change that. You still have to keep that.
Yes.
Clear? But they say you can use allograft temporary only. Faham?
Yes, paham.
So I did not change anything. I still keep autographed.
Yes.
But I now understand from the evidence, I can use allograft temporary. Faham? Clear,
Yes,
class?
paham.
Good job. Next group.
Clear.
Okay, good. Clear. Very
Okay,
good.
thank you
Okay,
very
next
much.
group. Next group. Group
Thank you
4
very
and group
much,
6.
group 3.
Next
Next,
one,
group
group 4, group 6.
Group
Now the
4.
rest of you, clap,
Ready?
clap, clap, all clap, clap, clap. I'm so happy. Good. Good job,
Clap,
everyone.
clap. Around 5.
Now 4 and 6. Come.
Next, group 4.
The rest of
Please.
you, I hope you're learning. Learn from each other. It's okay,
Yeah.
no right or wrong. We learn. Next.
Christina, ready to presentation.
What is the next one? Group 4, you wanted to
Group
do
4.
music therapy. Music, right? Okay, besar sikit, oi. This is PowerPoint, right? This is not Canva. Okay, besar sikit. Just make it bigger, Google PowerPoint. Okay, never mind. Bigger, below. Below, just make it bigger. Or full screen is okay. Okay, come, start. Okay, who's presenting? Present.
Okay, good afternoon, Prema. I want
Yeah.
to describe my business questions from my group for the
Okay,
evidence
go on.
practice by group 2. So for the PICO question is in preschool children with pain after cardiothoracic
Cardiovascular
surgery,
surgery.
how
Yeah.
does music video therapy compare to music therapy affect to decrease pain? So for the inclusion criteria is preschool children with pain after cardiothoracic surgery, Fujian maternity and child healthcare, children in the preschool age, which is 3 until 7 years, and underwent thoracotomy, which is the cardiothoracic surgery, and the hemodynamically stable. And then for the exclusion criteria is a history of chronic pain, visual or hearing impairments, inability to complete the study or intervention protocol.
Okay, stop. Number 2. No, stop. Go back. I got a comment. Number 2, under inclusion, don't use the name of the hospital. Just use the setting. Maternal and Child Health Hospital. Tak payah taruh nama hospital. Keep it broad. Because when you say Fujian, then I only can take evidence for Fujian. I cannot use in Singapore. I cannot use in Indonesia. Faham? Translate, Dia.
Okay.
Dia, translate. Don't narrow down to Fujian. Keep it broad. Tell her.
Baik. Oke, udah mengerti?
Cakap. Cakap.
Okay.
Understand. Okay, all right. So what's the conclusion? Let's look at the findings provide further evidence. No. I want to see conclusion. It's more effective. Now, both are M. So music video is more effective than music in reducing post or because it engages. So now, what's your name, girl? What's your name, student? Music one. Group 4, who's the leader?
Christina. I am
Christina.
the leader.
Okay, Christina. On top all those results, leave it first because we're not teaching statistics today. We're not doing statistics, but go down. Based on the conclusion, MVT is better than MT. Will you change practice? Will you change? No, go on. Will you change the question? Hello, just go to the answer. Will you change practice, Christina? After this systematic review, will you go to your ward sister and say, sister, I want to change from music therapy to music video therapy because the research evidence show music video is better. Will you change or will you not change?
Yes, I will change
Good
because
job.
music video therapy is non-pharmacological,
Bagus.
non-invasive, and associated with no
Okay.
repository.
Very good. Clap, clap, clap. Everybody clap. This is what I mean. If your evidence is strong, you can change. Later on, when I come back again, I want to teach you all those data up there, the statistics. What does it mean? There's some things to look out for, but not today. It's a bit more difficult. I'll do it another day. Okay, good job. Everybody clap. Well done. Group 4, group 6. Group 6, group 6. 6 now.
The last one is group 6. Please share screen, group 6. Okay, from Wiwi.
Okay, besar sikit. Oh, you changed to breast milk. Effective oxytocin massage versus. Okay, open first. I will comment already. Besar sikit, oi. Besar sikit. Perawat. Besar sikit, saya tak boleh tengok.
Slideshow, please.
Slideshow better. Use the slideshow. Okay. This group, wait, pause. I need answer questions first. Who's the leader? Apa nama leader in the group?
Wiwi.
With Tiwik.
Wiwi.
Tiwik. Okay, Tiwik. Question. In Indonesia, is it common you use katuk leaves? Is it a common practice?
Yes, in Indonesian, we use katuk leaf for make the breastfeeding it's more
Okay, good.
better.
So that means to say that katuk leaves is your gold standard. Yep.
Sorry, can you
Right,
repeat?
I said again, katuk leaf is a common practice in Indonesia because Singapore we don't use, but in Indonesia culture you use katuk leaves, and it's a standard gold practice. Gold standard, right? Betul?
Yes.
Yes,
Yes.
okay. So now your gold standard is that comparison, and your intervention is oxytocin massage. Okay, continue. Okay, continue.
Okay, now I would like to continue. Sorry. Okay, this is about the evidence-based practice and key finding. So we screened relevant quantitative quasi-experimental studies and reviews with the following criteria. The first is population. We used a postpartum mother with low breast milk production. And then the intervention, we use oxytocin message and then administration of galactogu herbs, specifically katuk leaves, and then outcomes of effectiveness of breast milk production. And then the language is English or Indonesian. The publication period is 2019 until 2025. And then the studies were retrieved from international and national journal database from PubMed, Scopus, Google Scholar, Indonesian Journal Database, and were summarized based on their abstract or report result. And then about the inclusion criteria, we have the first is about for postpartum mothers on 0 until 15 days postpartum, and then experiencing insufficient milk production, and then infant are full term and able to breastfeed, and then the mother without contraindication to breastfeeding. And then about the exclusion criteria, we have the first is mother with severe medical condition like uncontrolled hypertension, sepsis, and then the infants with oral abdominalitis or poor sucking reflex, and then the mother will with allergy to herbal product, and then the postpartum emergencies like heavy bleeding, sepsis, or critical condition.
Good.
And
Okay.
then
Wait, stop.
okay.
Show me the research evidence. Before you change, I need to see evidence.
Okay.
Show me the research evidence. Never change unless you're sure. Show me the research evidence before you change.
The research.
The evidence. Dari mana systematic review? Give me the abstract will do. Hello? Can I
Okay,
see the
wait.
research evidence? The abstract. I want to see the abstract of your systematic review.
Belum ya, belum ke-share ya, sorry. Sebentar.
Okay, never mind. You just read
Okay.
to me the conclusion. Okay, go down,
Okay.
go down. Down, conclusion. Go evidence. Okay, stop. This study suggests that oxytocin may serve as a complementary approach for reducing postpartum blues symptoms and enhancing breast milk production. Can support maternal by promoting emotional well-being. Okay, let me just look at the results on top. Wait, now just hold on first. The reduction was greater than the treatment. Okay, good. Okay, for this, who's the presenter? Apa nama awak?
Wait.
Vivek. Okay, Vivek.
Yes.
Based on this, will you change practice? Will you change? Will you go to your ward
Yes.
sister and say change? Okay, why?
For it cannot be changed.
Why?
But because the oxytocin is relevant to reducing the or increase the breastfeeding, but the Katuk lifts do not replace oxytocin missing, but can be used currently as a
Together.
complementary therapy to support.
Complementary. Okay,
Yes.
go back to the result. I just show you something. Tell you something. Go up a bit. Okay, can you see the word? The reduction in the scores was greater in the treatment group. Your treatment group was using oxytocin, right?
Yes.
The scores was greater in the oxytocin group than in the leaves, the whatever leaf you call it, right? The background, whoever's talking, maybe you want to mute yourself. Somebody's talking in the background. Ask them to mute.
It's
Okay,
already mute.
Okay, come back. So if I were to look at this, the reduction in this group that has got oxytocin was good, very good, greater. Correct? That's one thing. Secondly, there was a significant between group difference. The p-value is very good. Okay, because p is always less than 0.005. This is 0.000. So that means to say, third part, oxytocin levels increase significantly in the treatment group. Again, the p-value is very good. Okay, so the results are very good, whereas no significant change in the control group. That means to say, going back to that oxytocin versus your cardiac leaves or whatever leaves, the results are very good, statistically significant lagi. I will change the practice. So this part you haven't learned yet. When you learn about statistics, you also look at that. If the statistics are very good, I will change practice. Because they already said complement. That means I still give the patient a choice. You want to have leaves? See whether the leaves work. If the leaves don't work, as a perawat, I go to the patient, Bu Amina, I put the leaf for you, the milk not so strong. Let me try oxytocin massage. Then I say, okay, I try complement, right? Bukan tukar, complement. I try the kadek leaves, tak jalan. Then I take the oxytocin massage. I do the massage and see the flow may be better. So you walk to the patient with confidence to say, let me try this because research shows it is superior. Dia, translate this part, very important point. Dia, take over and translate from the research evidence upstairs. The results, talk about the result and what will you
Okay.
tell the patient. Okay, take over.
Oke, jadi dari hasil yang kalian sudah bahas, di mana kalau dilihat dari result itu sebenarnya sudah bagus ya data statistiknya, di mana massage oksitosin itu sudah bisa menggantikan cut lips. Jadi kalian misalkan kepada pasien kalian melakukan oksitosin dan juga pemberian katu di mana memang pengaruh dari oksitosin itu lebih bagus karena flow dari milknya itu lebih bagus. Jadi nggak apa-apa kalau misalkan kalian mau change the intervention menjadi oksitosin massage. Oke. That's all,
Faham?
Rama.
Thank you, class. Perawat, faham? Faham, put a
Paham?
thumbs up. Thumbs up down and see got thumbs up now. You understand or don't understand? Thumbs up. Okay, so only one
the
understand.
teacher.
Only one understand. Okay, more coming up now. Understand? Okay, so many of you understand. Okay, now I can ask you to stop share. Stop share. I want to share. Stop share. Stop share first. Stop the sharing. Okay, come back. I'll come back. Semua tengok sini. Now I'm going to conclude. Conclude. Bu Juni, are you happy that your perawats know how to write PICO? They know how to look for evidence and they know how to change. Are you happy, Bu Juni?
I'm so happy, Prema. My
Bagus.
student know which one is evident, which one can change.
Good. Okay, so we have
Okay.
achieved outcomes. Number two. So students, when you become nurses, the first thing you need to do is question what you are doing. Why am I doing it this way? Why can't I try something else? Then come out with your PICO, get the evidence. Once you get the evidence, you go back to your sister in charge of the ward and say, actually, I went to read. The evidence for oxytocin massage is so strong. So if the patient we use the leaf, katak leaves don't work, shall we try this? Then you convince the ward sister or the doctor. Research, not you cakap, research cakap, bagus. Speak up confidently that you can change. Faham? Yes? Okay. Now, before we say bye-bye, Bu Juni, do you have evaluation for them? Do you have evaluation?
Yes, Prema.
Okay. Okay, you have. All right, wait. When you do the evaluation, perawats, say what was good and what can be better. Because I don't speak Bahasa, that's my problem. Tell me what was good. You're very happy with all this, but I'm not happy with this. I want to know what you're not happy so that the next time I teach, I look at the area that you say you're not happy. I want to improve so that you benefit. Rather than saya cakap, lu awak tak faham, tak benefit. Faham? So that's number one. Number one is that. Number two, I want to take a picture of all of you. I want to take a picture. So we will all have our camera on. Bu Juni or one of the staff will take the picture. I want to see your names. So next time when I teach, I will ask you questions again. That's the reason why. Okay, okay, now can we have the gallery? The one spotlight gallery? Whoever is controlling gallery?
Okay, let's take a group photo with our guest lecturers, everyone.
Okay,
I
I
will
also
guide
must.
the
Okay.
photo session.
Okay. Or maybe wait, I try to put
Okay.
the same background. Nanti, saya taruh background sama dengan awak. Oi.
Yeah.
Ada. Saya ada
I
background
sent to
semalam
you,
Juni.
Prema.
Wait,
I
Juni
sent to
gave
you,
me.
Prema.
Yes, I have it, darling. I have it. I want to put the same background, but just now halfway don't want to disturb people lah, so I wait lah. Okay, wait a minute. Let me. I want to be part of Polytechers. Nanti. Okay, I don't want to blur my background, but I doesn't show to video. Okay, let me see the background. Can I put the background in? Camera, no. I want to touch up appearance. Okay, virtual background. Wait a minute. Let me find your background. How come the background tak keluar? Wait I don't want virtual background. I want to have my own add image. Okay, now I add image. Wait
Okay.
It's in my desktop.
While we waiting, please open the
Okay,
camera
done.
first.
Okay, all of you
Everyone.
on. Wait a minute.
Okay.
All siap? Okay, let's
Done.
smile and then
I
thumbs
will
up.
guide the
Thumbs up.
photo session.
Wait, all must put 2 thumbs
Thumbs
up like
up.
this. Thumbs up. If you're happy,
One.
thumbs up.
1, 2, 3, Okay, change the mode.
Okay, now you're
With the love.
love you all. Okay, love you all.
With the love. Okay, 1, 2, 3. Okay.
Got it?
It's already done.
Good. So send me the photo. Now, thank you very much, everyone. If you are happy, put a clap sign in the image. Clap, clap, clap. All of us are happy. You all did well.
Yeah.
All of you did well as well. Good job, everyone. Good job, every one of you. Good job. Okay, so remember, you can change the practice. You are a clinical expert. With that, terima kasih. Bye-bye. Saya keluar, Juni, saya keluar.
Thank you,
Saya keluar.
Prema.
Bye-bye.
Bye-bye.
Have a nice
Thank you.
day.
Bye-bye.
Thank you, Prema.
Bye-bye.
See you next time.
Okay, thank you to all groups for your excellent presentation and active engagement, guys.
Thank you all.
Okay. Thank you to our participant and active participant with this our guest lecture session. So I want to end this lecture session and I'll go back to the master ceremony.
Okay, thank you. Please give a round of applause to our moderator and our guest speaker. Ladies and gentlemen, as we come to the end of today's program, I would like to extend our deepest gratitude to the great guest speaker, my great moderator, and also the great participant for their active contribution throughout the session. We hope that the knowledge and insights shared today on evidence-based nursing will inspire us to continuously improve our competency, strengthen critical thinking, and apply the best available evidence in our nursing practice. So to close today's session, I would like to invite Nurses Nengah Runiari to close the session. Nurses Nengah, are you here?
Dayu, I think Ibu Nengah is in trouble, so she can join for closing statement. She has a message that thank you very much for all the team who have prepared this event. Can smoothly. And for the students, for all lecturers, thank you very much for the attendance. Thank you, Dayu.
Okay, thank you, Mrs. Made Juniari. Okay, thank you very much for your attention. I am Dayu Dia, and I sincerely apologize for any shortcomings or mistakes I may have made during the event. And I close this event with Parama Santi. Om Santi 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 Om. Assalamualaikum warahmatullahi wabarakatuh. Shalom Namo Buddhaya and have a pleasant afternoon.